It's getting worse in winter.
Oh dear.
My leg's been that bad and I've been that painful. I've like days where I can't even get up out of bed where I'm hurting that much.
How good are you at sticking your tongue out really far? How wide can you make your mouth? Oh, that's pretty good.
The new tablet can cause urine infections and it can cause thrush.
Oh, lovely.
That's quite painful now.
Well, you poor thing. Well, it's obviously you're going to need to go to the fracture clinic.
Right, OK.
Morning. Thank you for waiting. My grandson's just had a coughing fit where he couldn't breathe and all his chest is hurting.
OK. What's his date of birth?
Date of birth, Mark?
What, 2000?
22nd of May, 03.
Yeah.
You're supposed to know your own flipping birthday, you twit. Have a seat.
Thank you.
Oh, dear. Right, that's a big sigh.
Oh, yes. I was here last Tuesday.
Right.
That's with a UTI.
Yeah.
So I've had it before, but
Right.
this time was different. It was so painful.
Right.
So I came to the doctor, and then she prescribed for me some antibiotics.
Yeah.
And then she said between 2 to 3 days it should begin to clear.
Yeah.
So today was the last time I took it.
Yeah.
But I still feel pains.
So the urine sample that actually went to the lab, it didn't grow an infection. OK.
OK.
So...
So what's it then?
So Dr. Bolam did dip it and it did show white cells. So any discharge or anything down below?
No, not that I know.
No. Any new sexual partners at all?
No, it's only my husband.
Right, OK, OK. Could you do another urine sample for me now?
Yes, I can do that.
Saying that. Oh, one last bottle. If you go and do that and then come straight back in.
Right, I'll do that then. OK, thank you.
Come on in.
Thank you.
So this is Max.
It is. Well, we're here today because he's got a sore in the corner of his eye. So it's got to the point now where he's sort of not even sleeping properly because it's bothering that much. Like the other night we were up for 6 or 7 hours with him where he was just... Obviously, I presume where he was in pain with it, but we have rinsed it out with some salt water. It was a little bit...
So we're talking
not
about...
pussy. Yeah, there's a little, like, in the corner of his eye. There was a little bit of gunk, but I'm afraid that he's rubbing it into his eyes. Yeah. He's going to get an infection in there.
Hello. This is funny, isn't it?
What's going on? It's sort of catch 22 because he's not sleeping, so he's rubbing his eyes because he's tired, which is then making it worse, sort of thing, you know?
You know what? What I'm going to suggest is if I give you some drops, say keep the prescription,
right,
watch it over the next 48 hours, and I'm sure it will be getting better.
Yeah.
But if it isn't,
right, okay,
that's the next thing to try.
Yeah, OK. I know, mate, I know. I just obviously worry because his eyes is precious to...
Yeah. I don't think there's anything really serious going on. I think that's the first and foremost thing. So keep doing what you're doing. Next 48 hours, I'd expect you should be, if not home and dry, very close to it. If you're not, then you can get that from any chemist.
OK. Thanks for your time.
Sweetheart?
I can't find my patient.
Oh, unless he's gone in the toilet. Oh, I don't know.
Oh, I've lost him.
He's in a blue top, I remember, yeah.
Oh, right, he's not upstairs in the upstairs waiting room, is he? Because somebody's just come to collect him. Thank you. Bye. There's a gentleman there.
Hello.
We've lost all the doctors. Okay, brilliant, thank you.
I couldn't pee much because I did before I came
plenty,
in.
that's fine.
The sample that the doctor took, she asked me to call the lab to find out whether it's in. Are the results in?
Yeah, well, that's what I said,
okay.
that it's negative. When she dipped it, there were white cells in there and blood. Right, so there's 1+ of blood and 1+ of leukocytes again. So we'll send it off again. OK, if you jump on the bed, can I have a little feel of your tummy? Just pull this around. OK, so where's the pain?
Here.
A little bit there. That's quite sore there, isn't it? Yeah. OK, you can pop your stuff on.
Okay.
Most of the time, when we treat a urine infection, when we send it off to the lab, we would expect to grow bacteria. People can have infections in their urine or in their kidneys without it showing. Okay. So I feel it's probably worth us treating you with some further antibiotics as you're still symptomatic. Okay.
That's fine, thank you.
There we go. I hope things improve. Drink loads as well. Yeah.
Thank you.
OK, but if it doesn't get better, do come back.
Thanks.
OK, no problem. All the best. Bye-bye.
Thank you, bye.
Kerry Rich. Hello, hi there.
Hi.
Come on in. You look in the wars.
I have been.
Poor thing. So come in and have a seat.
Thank you.
Yeah, so I'm Dr. Lee now.
Hi. So I came off my bike last week.
Oh,
as you can probably tell.
Yeah.
So I was taken to Southmead. They did lots of X-rays and everything. Nothing's broken, which is good. But my shoulder has given me quite a lot of pain. They said there's nothing wrong with it. There's no break. But as you can see, the bone is in a funny place. And it's just really painful.
Can we just put your hair back?
Can't reach very far with both hands. My chest is really painful.
Is this a push bike you were on?
Yeah.
Wow.
It's really tender.
Can you move that up?
I can move it holding it, but I can't move it on its own. So that's quite painful there.
Can you come across your chest?
With help, I can.
Again, yeah, but
Yeah,
okay.
not on my own.
And I'm not even going to attempt to put your arm behind you.
No, I can't put it. I can't sort of put a cardigan on or.
But it looks to me as if the shoulder is dropped right down. So I'm sure. Did it look like that when you came out?
Well, I was laying down.
I suppose you were a bit out of it.
And I was laying down the whole time I was there. So I'm wondering if they actually realised it was looking like that. Obviously, I know it shouldn't look like that.
No, it certainly shouldn't.
Hello.
Hello.
I'm Dr. Bolam.
Good to see you.
Right.
A week back, I was here.
Yeah.
I was suffering with every year almost a fever.
Okay.
Apart from that, I'm having asthma.
Yeah.
So it's getting worse and
Oh dear. Okay. All right. So you think this is really your asthma, or a combination of the
combination,
asthma? Okay.
yeah, because it triggers with. I mean, asthma. It's in control.
It's not in control at the moment, is it really?
Almost every summer.
You always get a bit of a dip.
Starts with hay fever.
Okay, and then you're
ends
asthma.
up. Last year I was been to the emergency. Then my GP. He said, like, we'll try with antihistamine, which I'm trying over the counter.
Yes. Okay, so. Okay, so what you're wondering, I mean, I'll have a little look at you in a minute, but what you're wondering is whether you need the steroids.
Absolutely. That will be immediate relief and controls life.
Okay, well, I will anticipate we'll do that, but let's just check your okay.
Okay.
Can I just pop this on a finger? And you're not coughing up any spit? You don't think you've got an infection or anything?
Spit in the sense, white stuff sometimes coming. But
Yeah, but nothing green or not mucky looking? No. All right, OK. And what job do you do?
I'm an IT programmer.
OK, right. Can I have a little listen to your chest? Is that all right?
Absolutely.
Thank you. OK. OK. I'll wait till that's finished. You're a bit wheezy, aren't you?
Yes, absolutely.
Do you have a peak flow meter at home?
Yeah.
Might be better to stand up. Let's just have a look what your normal peak flow is. Do you know what it is normally?
I'm sorry, I don't remember.
I feel like coughing now.
It's not contaminated. I don't think it's contaminated.
I don't think you contaminate. I think it's psychological. So the last time you did it was 420. OK. I'll have a quick glass of water. Just blow it over that direction for me.
Oh, I just hold it.
That's better, I guess. No, 260. All right, so that's a bit lower than you were last week when you saw the nurse, all right?
Yeah.
OK. OK. I'll give you some... so the best you did there was 270. All right. If I was you, I think I'd be carrying water around with me. I think water would help a bit, wouldn't it?
Yeah.
Maybe we need to step up your treatment. There are options, but you think it's well controlled most of the year, and it's just bad in the hay fever season, really?
Season in summer.
OK. All right. Fine. I don't want to step it up permanently if it's normally all right.
Yeah.
OK?
Thank you very much.
All right.
Cheers.
That's a pleasure. OK. All right. Take care now. Thank you.
Thank you.
Bye-bye.
Where you come up to the waiting room, there's a door in front of you, and the health education is right in front there. But when I phoned her 10 minutes ago, it wasn't open. It may be... Oh, she's there now. She's going to come and collect you. There you go. OK. Take care. You don't want to be planted here. What she said. They're all a bit mad here. She's probably right with that. Tell you what, it gets you through the day a little bit quicker.
Neck sprain.
They didn't say that to me.
Oh. I think they completely missed it, actually. I mean, I presume that because the clavicle isn't fractured, because the collarbone is not fractured.
Yeah.
They've obviously. Are you all right to go down?
Yeah, I just. Oh. So I'm wondering, because I was like this the whole few hours I was there, if they actually.
Yeah. OK. Well, you poor thing. So I think obviously you're going to need to go to the fracture clinic. Are you all right? Can you help?
I just need a bit of help. Thanks. Thank you.
What about your face? How's that?
It's fine, yeah.
Is it?
I know it doesn't look it, but it is.
Bikes are so fabulous and so dangerous when you come off, aren't they?
I know. I went back to see where we came off today. We measured it and we reckon I travelled about 100 feet from where I left the bike to where I landed.
How did you come off?
The chap in front of me came off in a pothole and I was right behind him. Yeah.
Really difficult. Let me
So we'll have to wait a long time for this?
No, they run them every day, actually, so I'm hoping we can get you up tomorrow. Let's see. Yes, hello, it's Dr. Liz Lee here. I'm a GP at Hawford. I've got a patient who needs to come to the fracture clinic tomorrow, please. That's marvellous. Thanks very much indeed. Great, bye.
Brilliant, thank you.
Well, that's good. So what did they put on your sick note, actually? Shoulder injury or...
I'm not sure.
Well, I'll put shoulder injury, because that's the thing now. And if I give you 14 days, because I think it's going to take a little while, isn't it, this? So that's 2 weeks.
Brilliant, thank you.
Gone, but you better wait and see.
Thank you
Well, you
very
poor
much.
thing.
All right, thanks.
OK, OK, bye-bye.
Rocco?
Rocco.
Have a seat. Cool, that one's a bit fresh, isn't it?
Yes.
When was he born?
He's just over 3 weeks old.
3 weeks?
Yeah, born
You a
last
big
month.
brother now?
Yeah.
Big brother. How are you then?
He's complained of a sore throat. I can't really see in there. I've had a little look. It feels like his glands are up a bit. He's had a temperature for a few days.
Okay.
Keeps going sky high, but because he said his throat's sore, I thought I'd come and get him checked out.
Okay. Can we put your finger in there? Be careful it doesn't bite you, like a crocodile. You had your temperature done with one of these before?
No.
No? Right, it goes beep, beep, beep in your ear. Is that okay? Ready? Oh, you are a bit warm, aren't you? 38.4. So how long has he not been well?
Probably since about Sunday.
And how did it start?
Just the temperature. That's all I've noticed for the past few days. And he's been saying about his throat hurting.
When did his throat start hurting, did he?
A couple of days ago.
Right then, should we have a look in your throat? How good are you at sticking your tongue out really far? How wide can you make your mouth? Oh, that's pretty good. Right, look at me. Head back a little bit. That's it. Go,
Stick it right out. You've got to, darling, so she can have a look at the back.
It'll only take a second. If you do it
really quickly.
Go on.
We need to have a look to see.
Tell you what, we'll try it without this, OK? Stick your tongue out nice and wide again without this. You hold that. I promise we won't use it. If you've got hold of it, we can't do it, can we?
Stick your tongue
Open
out.
wide. Head back. There's a few little white spots there, I can see. Tiny ones. Right. Let me have a feel under here. Does it hurt under there, or is it OK? OK. Right, let's have a quick listen to your chest. Can you lift your T-shirt up for me? You had one of these before? No? Right. Big, deep breath in. That's it. Oh, brilliant. And again. Oh, you're good at that, aren't you? Wonderful. OK, so his chest's lovely and clear.
Good.
I think he's got tonsillitis, so that'll be why his throat's sore, and he's got high fever. So Calpol, but ibuprofen is going to really help take down the inflammation and help with the pain. So give him ibuprofen with his food 3 times a day, plenty of water, and do you know what the best thing is for sore throats? Ice cream. What's your favourite flavour of ice cream?
No. Bubblegum.
Bubblegum? Do they make bubblegum flavour
Yeah, you had it
ice
last
cream?
night, didn't you?
Maybe you might be able to have a bit more bubblegum ice cream tonight. You think that would help? Yeah. Yeah, so just plenty of fluids, paracetamol, ibuprofen. If you think he's getting a lot worse, give us a ring before the weekend. Ask for a telephone consultation, and we'll have a chat, and we'll probably do some antibiotics at that point. Sure. All right, what are you doing this afternoon?
You going to see your sisters?
Yeah.
Yeah?
Yeah?
Nana's got them, hasn't she?
How old are they?
9 and 7. 1 boy and 2 girls.
No, I've got 2 boys now.
Now 3 boys.
Oh, and Dad.
Yeah.
Yeah.
That's a big, busy house, isn't it?
We've got a crazy house, haven't we? Yeah, a bit crazy.
I'm reading the toilet and the bath.
Are you reading the bath?
Right.
Right, let's go. Thank you very
right.
much.
Take care.
And you, bye.
Hello.
I stabbed my toe a couple of days ago. It's a really hard, vicious, angry looking, and it's so painful. And I can hardly flip and walk.
You think it's infected, do you?
I think so. It's really, really painful. It's only small, but it's really sore.
So what are we looking at, another week?
You look a bit brown. Where have you been?
In the garden.
Ah, I'll have to go there.
Donna? Hi there.
Hi there.
Come on in, have a seat. How are you doing?
Bit better. Not much.
Right.
Financial side of things is slowly getting back together. I went to a job centre Monday. They've now decided until my court date comes through, I can go back on my ESA on the condition that I have sick notes to cover me.
So that's the it's an appeal for the benefits, essentially. That's what the court issue is. Yeah. OK. So you do need me to do a certificate today for that? Yeah. OK. So we're going to put drug addiction therapy on, because that's what I wrote last time. Yeah?
That and chronic pain.
Yeah. OK. Donna has had problems with chronic pain since her mid-teens and was initially prescribed opiates by doctors, and then she acquired more illegally. The script that she has from me is for a drug addiction therapy, but it is also treating her chronic pain. She could come off her opiate medication, and this might help some of her symptoms, like agitation, fidgetiness, but she has been reluctant to do this. So I'll print that off. And then your scripts, they are going to run out, aren't they?
Yeah.
So at the moment, you're on 16.8 milligrams altogether. Yeah? And what's your thoughts about that?
As it is.
Yeah? And are you using on top at all?
No.
Not needed.
Just, but I'm not doing it now.
Right.
Oh, I'm not doing it, I don't know.
Right.
I've had some really bad nights with my legs. It's not so much my knees, it's my legs.
Yeah.
I've got to the point now where I'm sat there in the night time and I'm crying where I can't sleep because I'm tired and I feel like I just want to cut my legs off or just do something with my legs.
So you went to the pain clinic and they really helped you with your pain management, didn't they? And you went and had lots of advice.
Like I said, I went on a thingy course, pain management course, to help obviously pace, manage. It's hard when you've got kids in that around you.
Yeah.
I do it every now and again. My legs have been that bad and I've been that painful over days where I can't even get up out of bed where I'm hurting that much. I've just completely packed gymming altogether.
Yeah.
I am trying to get myself back up there.
Yeah. That would be good, wouldn't it? My feeling is that you're on quite a lot of medication. It would be
I don't
best
particularly
not...
want to go on anymore.
No,
I really don't want to add to that.
I agree. And also, I'm not sure it really helps. The kinds of things that help are you taking a bit more control of things, isn't it?
That's what I'm trying to do.
And is your partner still being released in the autumn?
With a bit of luck, October.
Right.
17 weeks and counting.
Oh, really? OK.
I kind of really need him at home to help me.
Yeah.
I'll say some days there's a struggle, some days I just haven't got it in me at all. It's like I'm constantly, I'm sitting, I cannot keep my legs still because they're constantly irritating me. Yeah, because it's still swollen.
Yeah.
They haven't gone down at all. Ibuprofen hasn't took them down at all. I'm still taking them, but...
I think it's likely to be a combination of the fact that you don't do as much as you did, walking-wise. And the reason why we don't all have swollen ankles is because we use the calf muscle to pump the fluid back up to our hearts. And when you do less, then it does make a difference, OK? It just kind of pools down the bottom, and it's particularly bad in the summer, usually.
Yeah.
So maybe before you go out, you need to sit down and do those stretches first, just to kind of relieve a bit of pressure on everything, yeah? Why don't you try that out and see if that helps? OK. Was there anything else today?
No, I've been sick note, that's it. That was my main problem.
Yeah.
Slowly getting there, slowly.
Good. OK. All right, Donna?
Yeah.
So I'll see you in early August or sooner if you need to.
Okay.
Yeah?
Yeah, that's fine.
Good. OK. Bye now.
Thanks.
Hello there.
Hi.
Have a seat.
Thank you.
Right, what can I do for you?
It's a couple of things. Mainly, I've got an infection in my nose. Probably about a month ago, I had a bit of a cold, quite a heavy cold, and then afterwards got a spot in my nose, and then it's gone a bit horrible, and it's quite... I kind of thought, oh, it'll clear itself up. I'm trying to leave it alone, but it's just not. It's quite hard to breathe.
OK, so it's the spot that's bothering you more?
Well, I think it's got infected. That's what it feels like. It did get much worse.
Yeah.
So to the point that this, like, my nose actually got quite red.
Yeah.
On the outside, like it was quite hard and unpleasant. But it's been weeks and weeks and weeks now, and it still doesn't feel right. I can smell it. It smells wrong.
Can you? Right.
Yeah.
OK, can I have a little look?
Yeah.
No chance anything could have gone up the nose?
Well, don't know, in my sleep maybe. But not anything like that, no. Yeah. I mean, you know, it's just suddenly when you said that, I was like, I went camping.
Oh, horrible thought. Oh, dear. And it's the right side?
Yeah. So I think, the spot was just like at the front.
Yeah.
sort of, sort of in there.
Yeah.
But it sort of seems to be all around this sort of area.
Can I just feel around,
Yeah.
first of all? Any problems there?
No.
Yeah, so the spot is quite at the front.
Yeah.
I think we should just try some Bactroban antiseptic nasal ointment.
Yeah,
I don't think it warrants antibiotics,
Yeah, that's
okay?
fine, yeah.
Because it sounds a bit blocked, and could it be a bit of sinusitis as well?
Yeah.
But generally, that resolves on its own, and oral antibiotics don't make it any quicker.
No, that's fine.
Is that okay?
No, I'm absolutely fine with that. I'm also sorry, I'm just going to get it all out at once because I think I'm probably just need a rest. But I think I've got labyrinthitis again.
Right. How's that affecting you?
It just makes me feel low-level dizzy slightly all the time.
Yeah. Labyrinthitis is an infection in the inner ear, and this can affect your balance and hearing and occasionally cause nausea and vomiting as well. It's most usually viral, so often after a cold or flu-like symptoms, but often it eases off over a week or two.
There isn't anything, is there, apart from probably just resting and getting better?
When's that going to happen?
Summer holidays. I work in a school.
Right.
I'm the office manager in the school, so it's...
How long's left?
4 weeks.
OK. So are you looking after yourself at the moment, sort of in the evenings and weekends and rest?
Trying to. Slightly unsuccessfully.
Delegating?
Trying to. There's just a lot. It's that last term of the year, so it's quite full on. So...
What about at home?
Well, I've got 2 children, 9 and 10. There's quite a lot on for them too. But yeah, so I'm not doing that very well, and I do recognise I'm not doing that very well.
Yeah, it's hard nowadays, isn't it?
It really is.
I read something at the weekend, actually, putting a block on your email. I am not reading emails after 5 o'clock on Friday or whatever.
Well, I'm certainly intending to do that from September.
So why can't you do that earlier?
Because there's too much.
Because what will happen in September? Oh, well, it's the start of term.
Yeah.
It's.
No, you're right.
Doing more than you're meant to, I think, is the norm these days.
Yeah.
But doing it that you're feeling a bit run down, I think that's where you need to have a think. Yeah. Is there a way you could have 2 days off at the weekend?
Yeah. And have the weekend.
Yeah, because it's so hard.
To get the balance, yeah. No, you're quite right.
Yeah.
I mean, it's how it should be, but yeah, no.
Yeah, there we go. OK, well, I hope you cope till the end of term.
Yeah.
Be nice to yourself.
Thank you very much.
If that doesn't clear up, please do come back.
Lovely.
All right.
Thank you so much.
No problem. Bye-bye.
Bye.
That's okay. Right then, so you come for your ischemic heart review today, yeah?
Yes, that's right.
Okay. So how has everything been? Any heart pain?
No problems.
Or anything? So we just check your blood pressure. Okay. Oh yeah.
Yeah, that was the last sentence. Took my blood.
Oh, shame.
I think she was next. No, it was this one those days.
Yeah, it is, isn't it? I've had bloods taken before and bruised all of it.
Yeah, just getting the vein right.
Do it again in 1 minute, all right?
Yes, OK.
So just, and how active are you?
Oh, moderately.
Yeah.
I did go dancing on Saturday,
Excellent.
which is quite an achievement.
Definitely. What music was it?
Oh, mostly sequence and modern
Yeah.
ballroom dancing.
Oh, how lovely. Right then, gonna do it one more time. I
And
think it's
that's my
lovely.
granddaughter, she's only 12, and she's very good. She's good at most of the adults there.
Oh, good. Can I check your weight? Is that okay?
Yeah.
$86.
What
I'll convert for you.
Yes, well,
Yep.
that's converted to...
Yeah. Oh, you've lost weight, actually,
Yeah,
since
well,
last year.
I tried to keep it balanced.
Definitely, yeah. 13.5 stone.
Not bad.
Good. Now, the blood results then, let's have a look. The only thing that came up was that the blood that we do that kind of looks at the amount of sugar is slightly up.
Is it?
What do you eat?
Average stuff, you know.
Yeah.
I don't take sugar with tea or anything like that, but I do eat cake and biscuits and things like that.
Yeah, it might be just worth cutting that back.
Watching it,
yeah, you know, just things that are more like sugar laden.
This is the first time I've ever been told this, actually.
So that's the only little hiccup is the sugar. So we'll just keep an eye on you. Yeah. But otherwise, carry on. Thank you ever so much.
Thank you very much indeed. There we go.
So I'll put it in the notes that you're to have the blood test repeated so they know what they're doing when you come in.
Okay. Yeah,
all right, lovely to meet you.
Thank you.
Take care.
My son, I'm not sure if his hearing's right or if he's just being ignorant.
Okay,
So.
that's fine. What's his date of birth?
Coco.
Yeah, go on then.
You're going to come this way with me.
Go on then. Hello, doctor. Here's that.
There we go. Who have you brought to see me today? Coco.
I think she's got hay fever.
Right.
She's waking up. When we're outside, her nose gets really snuffy and her eyes cry, but she's not crying.
Okay.
They just run tears.
How did that freak up?
Be quiet.
She's under one, isn't she?
Yeah, I took her to the chemist and they said she was too young for anything.
Yeah, it's quite unusual to see it in children so young. And when did you first notice it?
We were out. We went to a little festival,
right?
And that's when I really noticed it. As soon as we got there.
Okay.
She was just miserable, and she was fine at home. But it's when we got there, and then her eyes just started watering.
And it was grass and.
It was hay actually.
Hay,
there was boughs of hay. It was it was a street.
Fine. Okay.
So we thought maybe she had hay fever.
And then since then?
Since then, it's happened again once, and we were out in a field.
Fine. So it's sort of it's specific to those
areas.
Settings.
Yeah,
right.
yeah.
So it's pretty clear, as you say, that it must be something to do with it. Is there any hay fever in your family?
On my sister's, yeah. Blue Jay's got bad eczema, and I suppose is that all linked?
Yes.
Yeah.
Yes, it can be.
She's got really bad eczema.
Yeah. Okay. But Coco's skin's okay.
Her skin's fine. Yeah.
Okay. They've kind of made it rightly more difficult to prescribe things for little ones because I think there was concern that kids were being given stuff that wasn't suitable for them.
You've got bad skin, haven't you?
Eczema.
You've got.
This is hurting me again.
Let me see. Where are they hurting you to? You can't take them off yet because you need to walk on the floor.
Okay, let's have a look. Oh, actually, it does say we can use 1 milligram twice daily. And you'd only need to give it her in the circumstances.
If we were to go into like a grassy area.
Looking very serious, young lady.
Yeah.
There we go.
Thank you.
Okay. Bye. What about your shoes?
You need to put your shoes on before we go outside, okay? Yeah, we're going to go outside now in the street.
I want you to carry me.
I can't carry you. I've got to carry your sister. Thank you.
Let me do the door, hang on. You don't want shoes? Then you want Mummy to carry you?
Say bye. Say thank you.
Bye.
Peter Fraley. Hi. Morning.
Sorry?
I said morning.
I heard you the first time.
Sorry. Just trying to be friendly, you know. It's just
Yeah,
my
I know,
standard
yeah,
politeness
as you
thing.
are.
What are we talking about today? How are you getting
Heaven
on?
knows. You told me to come back in a fortnight.
Yeah. How have things been?
Well, 4 or 5 days I felt quite bright. And then back again.
Yeah. And there was also the question about starting this new tablet from the Diabetes.
I don't know anything about a new tablet.
So the new tablet is designed to try and improve the sugar control. And its side effects are that it may cause you to get some urine frequency, and it can cause urine infections, and it can cause thrush.
Oh, lovely.
And what the guidance is you drink plenty, like loads.
Yeah, I've been drinking lots.
Saying drink a glass of water every hour in order to make sure that you're well hydrated all the time.
Yeah.
But if you're OK with that, we could get this new medicine started.
Yeah.
And hopefully that will bring the sugar levels down. When did we last check the sugar level? Just give me a... April.
Was it? Oh. For months now, I get into bed at night and I get only the top half of me, a tingling sensation in my arms and my chest, and then it just goes away.
How long did it last for?
A couple of minutes.
Yeah.
If that.
And every day, every hour, every minute?
No, only at night.
Only at night. And does it kind of shiver over you, or is it?
That's the one.
Yeah.
Yeah.
Okay. And is it all normal when I touch you? It feels normal?
Yeah, fine.
Okay. Just put your arms out in front of you, palms towards the ceiling, close your eyes. Squeeze tight, pull me towards you, push me away. That's lovely. So that's all working normally.
Yeah, it's just an annoyance.
Yeah. How bad is it? When you say it's an annoyance, is it stopping you doing anything? Or
No. Ow. It's just like you go, like that.
Yeah.
I just thought I'd mention I've had it for months and months and months.
I mean, sometimes when you have diabetes, it can affect the way that the nerves work. And this may be that you're getting symptoms linked to the nerves being affected by the sugar, because the sugar coats the nerves and stops them working properly when you get diabetes. And this may be one of those symptoms of
that's
diabetes.
what I put it down to. It's got any worse, it just comes on now and again.
Yeah.
And then
there isn't an obvious, easy fix for it other than keeping the sugar level really controlled. And it would be worth us checking the other vitamins that sometimes cause nerve symptoms to make sure that they're OK when you have your next blood test as well. So
is there anything I can take to make me feel brighter?
Well, there's not a magic potion, if that's what you mean.
I know that.
Like a tonic or something like that. But getting the sugar level controlled is the
thing
best
as a
thing.
tonic.
I know.
You told me that before.
Probably did. Well, the main thing is getting the sugar level down.
That saccharin's OK to take with...
Yeah, so that's better than taking sugar, yeah.
I hate sugar, but when I have my Weetabix or whatever, I have a sprinkling of that, and that's OK.
Exactly.
So I don't want to take... I had a big Spassenberg last night, and I was a naughty boy. I know.
Oh, well.
Well...
These are the challenges of life, aren't they, though? And it's very difficult to avoid everything. I do appreciate that.
I'm quite bright this morning.
Good. Well, let's see how we get on with this new tablet. I'll see you in a few weeks' time when we can see how it's getting on.
Yeah.
Maybe a month's time.
Yeah.
All right.
Thank you very much.
See ya. Bye.
Ooh.
He's still here?
Well, the hours, yeah.
Oh, really?
Yeah.
One of those, yeah.
Puspa Patel, please. Bit of a hike down the corridor, I'm afraid. That was a bit of a mini marathon. OK. So, how are you? She's all right.
Yeah, the tablets done the job.
Done the job?
Yeah.
Really?
Yeah.
The problem she had before was the food coming back up. That stopped happening?
That stopped happening now. Yeah.
That is a good result, isn't it?
Yeah.
So we checked the poo sample and that was clear. She didn't have that bug again.
No.
So I think that the problem, therefore, is this, you can translate for me, obviously, the hiatus hernia, which they found when they did the endoscopy. If she doesn't take those tablets, that causes acid to come up and cause that problem. OK?
Yeah.
So I think she should stay on these tablets for life now.
Okay. So tablet આપી છે ને એ કાયમ માટે આખી લાઈફ તારે લે જ કરવાની હવે નહીં તો પ્રોબ્લેમ થયા કરશે પાછું એસિડ. Okay.
Does she feel in agreement with that? Is she happy with that?
She's happy with that.
She doesn't want those horrible symptoms back again, does she?
No.
OK. And then she's on her calcium tablets for her bones.
That's right.
And her asthma treatment and her water pills. Well, I think that was a good decision that we made last month,
right,
wasn't it?
yeah.
We didn't need to do an endoscopy.
That's good.
Okay, and I think, you know, hopefully, obviously, you come back and see me if there's any problem.
Yeah.
Is that all right?
That's all right.
Okay.
What about you?
Does she want to ask me anything?
Which was going to say?
I had 2 days.
This is if I'm not well, I'll come back.
Of course. Okay. And no trips to India planned?
No, not anymore.
Not anymore?
Finished.
No, finished, yeah. Okay, all right.
Oh, she said in 2 days' time she'll be 86.
Happy birthday. All right.
Yeah, thanks very much.
Thank you
Dr.
very
Moran.
much.
Thank you, bye.
You all right with that long walk again?
Yeah, thank you.
Okay, all
Thanks.
right then.
Bye.
Bye-bye. So you know where I am.
Sarah Jean's place.
I've got this
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream.
Uh-huh.
I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it
Or
did
does
do.
it not?
Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK.
No.
Just returning that key.
Wonderful. If I could ask you to put that straight on one of the top first 4 hooks, that would be very gratefully received. Thank you very much indeed. Pleasure doing business with you.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here.
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right, so you've got COPD.
Yeah.
Yep. And any other, you've got diabetes.
Well, they think I have, but they think it might be to do with, because I'm on so many steroids.
Right, OK, well, we'll talk about that in a minute. And then, so you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike. Right, and he's actually going to do a check of your heart disease, your diabetes and your COPD.
Shall I bring a packed lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, OK? So I'm your doctor, and we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
OK, then, thank you.
Good. Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. OK, bye now.
Thank you.
Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
OK.
And of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? Well, they cause skin infections really commonly. They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done. All right. Nice to see you. Yeah, no problem. Nice to see you. Bye.
Bye. OK, that's fine if you'd like to go to the upstairs waiting room.
OK, no problem.
Thank you. Hello, can I help?
Mr. Apatrasoe.
Yep.
I'm Dr. Lee. Come on down.
I expect to be from China.
Yes.
Or Jet Li or Bruce Lee.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
I have, yeah.
Where have you come from?
My father from Belarus, my mother from Greece, from Athena.
Yeah.
And I'm Danish resident. After the high school, I was a security officer from army. SWAT, the special squad, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
Tell me a bit about it.
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here. And 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect, no problem with this. The only thing what put me down, it's sinus. I have pain. It's sinus. I don't feel good.
No, and you're not taking any tablets or medicine?
Today I don't take it, nothing.
No, right. So is it here? Just right there.
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there.
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones are all right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you.
I'm just going to do your blood.
Go out.
Yeah, but it does make it very likely that your sinus is infected. So you have diagnosed yourself correctly, I'm sure. Okay. Relax a little, and I'll just see what this is going to be up to. It's 184 over 104.
Because of pain.
Do you think? Okay.
I'm pretty sure about this. Okay. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
yeah,
and then 1 every day till you've used them up for a week. That should settle it down. You must now book an appointment for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope
welcome.
To see you in 3 weeks.
Come on in. Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing. It bled everywhere.
Bled?
It was. I think it was a varicose vein on the surface of that.
Yeah.
I was washing up and it just bled everywhere.
So it was the bleeding that kept you in hospital?
It was the bleeding that kept me in hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the blood doctors?
Yeah, I'm getting one. I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
It's
the
all
big
covered
dressing?
up.
Let me not look now, because actually, as long as it's OK from your point of view, the nurses are going to look this afternoon. So if there's anything if I take the dressing down and it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of OK, but I'm kind of waiting to go down.
And was it depression that you suffered with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they get, other thoughts or other...
Yeah, I have been there.
More serious kinds of thoughts.
Yeah.
Has that drifted in, do you think?
Yeah, a little bit.
Hello, can I help, sir? All right, can I help?
That's exactly why I'm here, hearing problem. You go on,
I know, absolutely.
Catherine Amesbury, please.
Oh, that's me. OK.
Hi. Come have a seat.
Nice to meet you.
Right, OK, so we spoke on the phone beginning of June, didn't we, about your X-ray? Yeah. Yes, OK. And how is your back?
Bad.
Right.
I've got a trapped nerve now. It's just constant pain. So
OK.
I don't know. What did the X-ray show?
Well, it shows some wear and tear, but it also shows reduction of the disc height on a couple of levels, so it makes me a little concerned. Is there any thinning of the bones?
Well, I've got sciatica at the moment all the way down this leg, and my leg's actually not working properly.
Right, OK.
It's really strange. It's like it doesn't belong to me.
OK, can we have a little look?
Yeah.
Put yourself up on the bed. OK. And if you bend this, so try and pull your heel into your bottom, OK, and push it up to the ceiling. Good, OK. Against again. That's it, right?
That's the weak one. Can you see where it's wobbling?
I'll just check your reflexes. Yep. Good. Fantastic. OK, you can jump up for me. OK.
I had a riding injury in my very early 20s, and I displaced 2 vertebrae, and it never was quite the same after that.
Sure.
But regular osteopathy. I mean, I can go for 2 or 3 years without seeing her, and then I'll tweak it, and she'll get it right. But this time, I haven't been able to get it right. So, yeah, I'm just frustrated because I can't live my life the way I normally live it.
Yeah.
My maternal grandmother had osteoporosis. She was bent double in her 70s.
Right.
But I have been on prescriptive calcium, vitamin D since my 40s because there was a risk.
So this graph shows us the green is essentially you don't need to do anything, OK? The yellow is we need to measure your bone density via a DEXA scan, and red, we need to just treat. Now, you are very much on the border.
I'd like to know then if I
Yeah,
can.
I agree. In terms of your pain and management at the moment, are you happy with what you're doing?
Yeah, I don't want any.
No. So we'll wait and see what DEXA shows. If you want some physio, just let me know.
Thank
All
you.
right, no problem.
Lovely
Well, nice to meet you. Yeah, you
Thank
too.
you ever so much.
OK.
Let me just check. You haven't had any more suicidal...
Not since being at home.
Plans or hopes to die or anything getting so serious that it's got that bad? No.
Not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away, don't do anything, don't allow myself to eat, don't allow myself to go to the toilet, nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot.
That's a common reaction or way of dealing with it.
and a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot. Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem. So it sounds, I mean, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to look at your, see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in sixth form, so when I was 17.
Yeah. So you've been on and off it for your mood for 6, 8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect.
Yeah.
And starting off slow and building up is a sensible thing, because then there's less to come off later.
Okay.
Do you want me to organise some counselling for you or give you the details about that? Because that's one of the other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
Oh, I do. Awesome. Thank you very
nice
much.
to see you. Bye then.
Bye-bye.
Hello, reception.
Hello, I need to make 3 appointments.
Hello, come on in.
Suffering terrible with migraines. Been suffering for about 6 years. I did get a preventative topiramate.
Okay.
It worked, but it stopped working now, so I've just given up taking it. I just thought it's best to come in and see you.
Yeah, have a chat about it. How often are you getting them at the moment?
I can get 5 a week sometimes.
Describe them for me, just
So I go funny in the eyes, and the head feels like it's being, and it's all pain in the neck as well. Just like a pressure building up, and then you feel like you're sort of slurry talking and things. So it's just strange how they just come on all of a sudden. The Imigram tablets are really great when you get an attack, but they do make you feel a bit... But they're brilliant for when they are needed.
So they're quite effective.
Yeah, amazing.
Yeah.
I just wondered if there was any other type.
Yeah. The answer to your question is yes, there are other things we can try. There are actually quite a few different preventative treatments for migraines.
Okay.
So we often try beta blockers, which were originally designed as blood pressure medication.
Okay.
But we use them for migraine treatment. They very occasionally drop people's blood pressure a little bit, and that can make you feel a little bit dizzy the first time you take it, while your body's adjusting to it. So we'd often try one that's twice a day.
Oh, twice a day.
Initially, I'll give you a month's worth as a kind of trial.
Okay.
If you find that it's not really the answer, give me a ring or come and see me again.
Yeah, it's easier to find sometimes, isn't it? Thank you very much for your
Yeah,
help.
great to meet
nice
you.
to meet you as well.
Hello, can I help? Hi there, it's Dan from Speechwrite. I've got an 11 o'clock with Guy. With? Guy.
Glyn.
Glyn, is it? Oh, they put
Oh.
Guy. Sorry, Glyn.
Leave me. The scarf though.
Just get a phone, come back in.
I'll probably be still sat here.
Probably.
Okay.
If you're not.
Sean Priest, please.
Oh, here we go. That's me. Hey, brilliant. Hey, can you guess what it is yet? Oh, yeah, definitely, yeah.
Right, I'm Lizzie.
Hi.
What's been happening?
So, Tuesday of last week, I had a motorbike accident, collision with another vehicle. Fortunately,
Car?
yeah, well, Volvo, so, you know, might as well have been a tank. Yeah. So I was thrown clear of it, landed on the verge, but I took all the impact on my hip. I managed to sort of bounce off the side of it and do a bit of a Superman impression
Through the air.
into the verge on the other side of the road. Basically, I can't sleep. That's one of the main issues because of the pain. Also, I've got some concerns. The blood from the bruise is beginning to spread. It spread around my sort of lower back, down my leg. It spread across my groin and into other areas.
Right.
Yeah.
Okay.
Yeah. So that's kind of a bit interesting there. So.
Okay, can we have a look?
Yeah.
All right.
Sure.
See how bad it is.
Yep. No problems. I'm unhappy to mention it is affecting my sex life, as if having a smashed up hip alone wouldn't.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
When you say it's affecting your sex life,
It's spread into my testicles and pretty much halfway up.
meaning that it's painful or you can't get an erection? Or...
No, I'm functional, but it's tender, very tender, yeah. So, yeah, if I could figure out how to manage that, that would be nice. Or just an idea of how long this is going to go on for.
Right, so, okay, pull your pants up.
Yep.
Come on, have a seat again. So, the amount of bruising that you've got,
Yeah.
I'm not surprised at. I wouldn't be overly concerned about it. Given the mechanism of injury, to have come away that lightly, it's probably only down to the fact that you're quite muscly and you've got muscle to protect all of your bones and everything.
And muscle that bruises easily.
Yeah, you've obviously caused so much damage underneath your skin on the hip here.
Yeah.
It's filled to a capacity and then it's not really had anywhere else to go, so it has spread round the other sides a little bit.
Yeah.
Have you noticed it carrying on, spreading further? Or
Yeah.
is it
It's reached the back of my leg just today. It was about here before, but this morning it's sort of down there. It seems every time I wake up, it's in new and exciting areas.
If at any point
Yep.
it looks like your circulation is changing at all, if this lower leg starts going a bit of a funny colour, if you start to lose some of the sensation or anything like that, need to see you straight away and probably send you up to the hospital. In terms of what you can do to try and reduce it, the only thing that you can really try is just to ice it.
Is there anything I can do for the sort of pain management side of it and sleep?
Paracetamol, 2 tablets, 3 times a day during the day, and then your 2 cocodamol at night.
Okay. Are there any kind of maybe almost like home remedies I can use to sort of try and disperse some of this blood, or?
Just gentle. You could try a gentle massage.
I'm talking about one specific area.
Not like deep tissue. Oh right, okay.
Yeah, it's not pleasant, and it's
There really isn't very much that you can do.
Okay, I'm happy to try deep tissue massage on the area. But,
I was thinking of your leg.
Brilliant.
I would just give it a rest if I was you.
Yeah.
Just give the whole area, just give it a rest.
Right, okay.
If it's hurting, it's trying to tell you, give it up. Just stop for a bit.
Okay. Put it on the back burner.
Yeah.
Brilliant.
Abigail Lee, if you can walk like that.
I can walk and feed.
Well, I'm Dr. Lee, so that's very good.
Yeah.
We share a name.
Appropriate, isn't it?
Hooray. So, is this a girl or a boy?
A boy.
Oh, very nice. And is it your first or not? How? So today, starting with you, how was it?
What, the birth?
Yes.
It went as well as such a thing does.
Yes.
Basically.
It's quite an experience, isn't it?
Yeah, and we had a home water birth. And that went really, really well.
Ooh, did you?
Yeah.
For a first baby, that's very good.
Yeah, it went. Yeah, it was. Well, I won't say it was good exactly, but it went well. I didn't use anything, and yeah.
Well, it's very unusual to actually manage your first at home.
Yeah.
Did you tear or have stitches?
I did tear and I did have stitches. Yeah, I had a 2nd-degree tear.
How is it? Has that healed up quite well or not?
Yeah, I think so. I mean, I don't feel anything anymore. I guess I'm not sure when it sort of. Oh, thanks for that. I'm not sure when it stopped hurting, really. It did hurt for a lot longer than I expected it to, I have to say.
So would you like me to have a look? Or
I think
if
I'm
it
all right,
feels
to be
fine
honest.
to you, it's never quite the same as
Yeah.
it used to be. But as long as it's not too tight, really, that's the thing. Occasionally people get sewn up and they're just a bit wonky or tight. And that often settles down. And
That's all right.
sex, have you had sex yet?
Who wants to have sex 6 weeks after giving birth?
And did you have any other problems in the pregnancy that I should know about?
My left outer thigh went numb, went about 20 weeks, and it's still numb now. And I assumed after I gave birth, I thought, it will just go away, but it hasn't.
Which bit of it's on the outer border there?
Starts about here, goes down to about here.
Are you all right?
Yeah, yeah, of course.
Take him over here. You can just lie him on you.
Do you think you could hold him just for a sec? So I leak really badly, and I've got these breast shells. It's a bit embarrassing, and I frequently do that as well.
Well, I'm having to practice because my first grandchild's coming soon. So
oh wow! Congratulations!
I know. So this is kind of fabulous.
Just up here,
like that, and then if you take him.
Yeah. Hello, little one. Ooh.
Okay, that's great. So here's a bit of cotton wool, and I'm just touching your other leg with that. Can you feel that?
Yeah. Yeah. Yeah.
And how does it feel? Is it?
It's really hard to describe because it isn't.
It's less.
Yeah, it's just less. That's the only way I can think to describe it.
Mm. Now, I'm not going to hurt you with this, but I'm just going to... It's a pinprick.
Yeah. Yeah. It's very, very slight, though.
The good thing is the sensation is actually there.
Yeah.
Get that back up. I'll come and help you in a sec.
Thanks.
So the sensation is there. That nerve has obviously been probably bruised at some stage.
Thanks.
I think it's a matter of waiting. The nerve is working because you can feel pinprick, you can feel different kind of sensations there. And although it's a bit dull, it will slowly come back. Sit tight, it will almost certainly just slowly recover.
Hi, I've run out of my pills. I don't know if I need to make an appointment with the nurse or can I just get a prescription?
Contraception?
Yeah.
A nurse appointment every time you need a prescription.
Oh, is it now? Oh, I thought it was every, like, 6 months or something.
Hello there.
All right.
Come along. So I think Dr. Pitt arranged for you to come and see me, is that right?
Yeah.
Yeah, and prior to that, you'd seen a physiotherapist who thought that it might be useful for you to have an injection. Yes. And they've written in the note that they think you've got something called trochanteric bursitis, which is a inflammation in the layers over the hip joint. Yeah. On which side is that? Is
on the left.
Left side. Yeah. Can you show me where the pain is?
I'll stand up and show you.
Yeah.
There.
Yeah, let me just have a feel down here. If I hit a sore spot,
yes,
that's it there, is it?
Yes.
Oh, sorry. Okay. Well, that is over what we call the greater trochanter, so that would fit with this. So what Dr. Pitt suggested was that maybe we put a steroid injection into that spot. So you're happy to go ahead with that on that proviso? Okay.
Give me back my legs.
Sorry?
Give me back my legs.
Well, don't have too high a hope, really. My hope with this is that we will relieve the tenderness at that sore spot.
It's worth a try.
It's worth a try. So I'll need you to get up on the couch. What we've got here is some steroid with local anaesthetic in with it. Any problems after this injection, particularly if you feel that it's inflamed or you've got a fever, do get back in touch with us. Okay. Now, I'm going to need you to lie on your side. I'm just going to mark the point. So next thing you feel will be a slight prick as we put the needle in, OK? I'll need to put it... Is that OK? Not too sore? OK, that's done. All right?
Is it? Is it done?
Yeah, it's done.
That's incredible.
There you go. Stick that on there. Good, we're done. All right? Do you want a hand down? Are you OK? Sorted?
Thank you very much.
All right. But we might do it again if it does work and it wears off.
It doesn't feel like anything's different.
No, but it won't work immediately.
Oh,
Give it a bit
OK,
of time.
thank you.
Give it a bit of time. OK, then.
Chris Collins, please. Morning.
Morning, Doctor. Thank you.
Hi, have a seat.
Well, basically, the big reason I came in is for the results. Are they, for the scans? And they took me into the ring thing, that you go in.
OK.
Yeah.
Let me just have a little look. I'll just get up those results. Well, the good news is that the scan is normal, and if you get more blood in the pee in the future, then we should send you back there. But at the moment, that's all that we need to do.
Right.
So that sounds like all pretty good, doesn't it?
Yeah.
And how's your mental health at the moment? How's that all going?
Oh, not too bad. Having moments when I sort of talk to myself a bit. Not answering myself, but...
Has that been stable in the background, or is that...
Yeah.
Yeah.
There is some times when, and I got he comes from the Greenway Centre, and I talked to him about it, that sometimes I'll look at someone driving past when I'm on the bus and think there's someone I know, like, you know, and it's just trick of the mind, you know.
Sure.
But I think I have, at the station, actually seen a poltergeist, you know.
Right, Maddie, do you want to sit over there? Rio, you can come over here.
OK. How can I help?
So Rio suffers nosebleeds quite severely.
Yeah.
Through the weekend, he had 4. 2 were very, very bad, really struggled to stop them. I pinch it up here, it then goes down his throat.
Yeah.
And he spits out. So I literally have to just wait for it to start congealing in his nostril. Yeah. He cries with them as well. I don't know whether or not they're hurting him.
Yeah.
Since then, he's been very lethargic, very pale. I don't know whether or not he could get anemic from that. I have no idea.
How long did they last for?
So the first one he had, that lasted maybe 2 or 3 minutes. And then a couple of hours later, about 7 or 8 minutes. That was quite a heavy one. But then the last one, the third one, which was sort of in the middle of the night, that was quite severe. It was about 10 minutes. Okay. And we're going through like
show me, Rio, show me what Mum does. Show me where Mum puts the pinching. Up the top there. OK. So you need to pinch much lower down. OK?
Ah.
So that bit there is a bit solid. You can feel it's a bit solid, yep. Whereas where it's actually bleeding from, almost certainly, is just inside. So what you need to do... If is it always that side? Yeah.
That side,
so if you had a cut on your knee, what would you do?
Why?
What would you do if you had a cut on his knee?
Put pressure on.
Yes, so you go like that. So to put pressure on the nose, in that bit of the nose, you have to pinch the lowest bit, OK? But mainly it'll just make a scab, and that's what you need, is you want a scab, OK? So can I have a quick look up your nose? So if you just look up at the ceiling, very gently. And he's definitely got quite a good scab there now, OK? So the important thing is not to touch it at all, OK? It's quite common nosebleeds in the summer because the blood vessels get bigger anyway. Okay. What I would recommend is actually pinching for 10 minutes.
OK.
So the bleeding time should be 10 minutes or less. So by the end of 10 minutes, it should have formed a really nice scab.
Yeah.
And then it just needs to be left alone. Are you happy with that? And, you know, you're nearly at the age where you might be able to do this pinching stuff yourself, to be honest. Yeah? Rather than Mum doing it. Yeah? Nah. Is that all right?
That's great. Thank you so much.
You look very well.
Thank you very much. Getting there.
All right.
Come on then, kids.
All right, kids.
Thank you.
That's OK.
Bye.
Bye now. Bye, Rio.
Well, I know that in the past you've had problems with, you know, ideas that have been difficult to explain, haven't you? And delusions that are linked to your mental health problem.
Yeah. One stage, a car went... This is a long time ago now. Car went past, and do you know Data out of the Star Trek: The Next Generation, the robot? I swore I saw him in the car, which was quite funny.
The mind does play tricks on people, doesn't it?
Yeah, and I actually, I do actually see them. You know, I do actually see. It's not as though there's a blank space and I imagine something. I actually see something through my eyes, which is...
And that's what, you know, when people talk about hallucinations, that's what they're like. You know, they're really there for people.
Yeah.
And that's a really good description. So it's certainly not... Nobody's saying that you're not seeing it. It's just that that's part of the mental health issue, we think. Hallucinations are part of a group of disorders called psychotic illnesses, schizophrenia being probably the most common of these. For some patients with chronic psychosis, they don't have the insight that means that they can see the hallucinations and delusions that they're suffering are not real. And this adds huge challenge, as you can appreciate, to how we can support them and treat them. Fortunately, Chris is in a good place at the moment, and his medication is controlling those symptoms, and his hallucinations are something that he recognises, and so currently he has good insight into his mental health problems and how they're affecting him. We'll carry on with you being supported by the mental health team at the Greenway Centre.
OK.
And then I'll see you probably in 2 or 3 months if everything's going well. Super job. Well, nice to see you.
OK, Doctor.
Till next time.
All right.
Bye.
Bye.
Good morning. Have you date of birth?
23rd August. 1950.
It's next week, my lovely. What date? You did it online. 12th, next Wednesday. Exactly the right time, but a week early.
Kirsty Winskill, please.
I like your dog.
Oh, thank you. Right, I'm Lizzie. I'm one of the urgent care clinicians. How can I help you?
We'll go with a throat infection. This morning my throat is bright red. My voice is gone. It's very painful.
Yeah.
I've got a friend's wedding to go to tomorrow.
Oh, no. No singing for you. Is it a church wedding?
No, manor house.
Still at the back, I just had to mime. Right, OK. Do you think you've had a fever at all?
Hard to tell, I feel hot. But
Yeah, it's pretty hot. Yeah. Not felt freezing cold, though?
No.
No, good. Have you been taking any painkillers at all?
Not yet today.
OK. So your temperature's normal, 37.2. That's good. Let's have a look in your throat, then. Stick your tongue out for me. Nice big So it's quite red. Your tonsils don't look... Yeah, your tonsils don't look too bad. Let's have a feel of your throat now. Is this sore?
Yeah, there, yeah.
All over. Quick look in your ears. Have a stand up for me a second. OK, turn around. Let's have a look in this one. OK, so your ear canals are a bit red, both of them, and your eardrums look absolutely fine. So I think it's probably a viral sore throat. There's no pus on your tonsils. Your temperature's normal, which is good. With tonsillitis, there's two types, there's viral and bacterial. Viral is just really annoying, we can't do anything about it. It's just a case of just waiting and painkillers. I think are you off today, or have you got to go to work?
In work.
So just a case of rest as much as you can tonight, early night, painkillers, paracetamol, ibuprofen with your food, and the throat spray if you want to get some of that from the pharmacy. Okay. Loads of water, and try and avoid alcohol tomorrow. But other than that, have a fabulous weekend.
Try to.
All right.
Thank you very much.
See you later. Bye.
There's a lovely handbag here. Take care.
Thanks very much.
Bye-bye. Thanks.
Tidy up for her. Tidy up.
Don't worry. I'll do
Okay,
it.
thank you. Bye-bye.
Okay.
Thanks.
Bye-bye. Tidy up.
Tidy up now.
Batman?
Yeah, OK, brilliant. Oh, I lost 4.5 pounds. It's slim and we're
Well done. Don't look at the fridge now, though.
No, no.
OK, bye-bye.
Thank you for seeing me on such short notice, Doctor.
That's OK. Come on in, have a seat. I'm Dr. Graham. How can I help?
Right, if you look at my history, last year I had this case of a similar situation like this where my mouth lost skin, I couldn't eat very much, but compared to it now, that was like a 3 or 4. This started off again on Tuesday or Wednesday.
Yes.
I have lost skin everywhere. I haven't eaten a solid meal for 4 days.
Yeah.
I went to the pharmacist. They recommended something called codeine with paracetamol.
Yes.
Which the pain has subsided, but even now, here I can still feel that constant throbbing. My head is hurting. But this hasn't happened for over a year now.
Yes.
I don't know what's happened.
OK, and do you have this kind of problem anywhere else on your body?
No.
No. You don't have
else.
any problems genital ulcers or anything like that.
What do you mean by genital ulcers?
Well, you've got mouth ulcers, that's what these are. They haven't got anything on your penis or anything like that, no. Just very rarely there can be a connection when it's quite severe, but it doesn't sound like that's the case.
No.
Can I have a look in your mouth?
Right.
Yeah?
The only thing, doctor, my mouth probably smells a bit bad.
Don't worry about that.
If you want to probably put on a mask or something, at least it makes me feel a bit better.
No, I'll be fine with that.
Thank you.
Hello. Are you Phoebe?
Yeah.
Very good. Let's give you a chair, Phoebe. Are you going to sit there?
There you go. Ready?
And who's this, Phoebe?
Nancy.
Nancy?
I got some spots. Do you want to show the doctor where they are? They're on my belly.
Well, wait a minute. I think I need to ask Mummy a few questions first, and then I'll have a look at your spots in a moment. All right? How long has she had the spots for?
About 4.5 months. And they're only behind the legs here and a couple on the belly, and they look like little skin tags.
She's obviously reasonably well.
She's absolutely fine. I think she's got a little bit of eczema as well on the back of her legs.
Has she had eczema before?
Never, no. I think the hot weather's brought it out.
OK, we're going to have a look at your spots now, Phoebe. Will you show me your belly first? She's only got one.
She's got a couple on this
Oh, yes,
side.
I
You can
see.
see where she's and they've cleared.
No,
but it's
there's one. Look, that's a perfect one there.
Yeah.
The other thing is, Mummy wants me to look at your leg. Do you mind standing on the chair? If you just keep a hold on her. Yeah, a little bit. The name for that is molluscum.
Yeah, that's what I couldn't remember.
I'll print off the sheet for you. So it is a virus. And you don't want to do anything with them. Although they all go in the end, they can linger for quite a while.
Yeah, it just feels like
common, harmless, just try to ignore it.
But is that definitely eczema on the back of her legs there?
I think you'd call that eczema, but I mean, she may have got some spots and picked them and they've got a bit irritated. Let me give you some treatment.
Yeah.
Mild steroid, just for where it's bad. When you've cleared it up, leave it off and wait and watch what's happened. Okay. And if it then comes back, we would adopt a slightly different approach.
Yeah.
Here's some stuff on molluscum. I mean, she's got it very mild. Quite likely she'll get more spots. If she picks them, she'll tend to infect herself, but you can't stop her picking them. So.
Thank you.
Right, Phoebe, are you playing a game?
I need his gloves.
Phoebe, you may have that glove.
Oh.
Special present.
Wow, doctor's glove. Thank you very much.
Pleasure.
Can you sew it up?
No, that's Mummy's job.
Yeah.
Take the glove and take the book.
What do you say to the doctor, Phoebe? No! Can I?
Very good.
Right, you're going to take your glove?
It's lovely to see you. Bye-bye. Bye-bye.
See his next patient. Thank you.
Goodness, it's quite a lot, aren't there? And then open up wide. Yeah, you've got a lot on the roof of your mouth and on the back of your mouth as well. All right, so most of the time, this is due to a viral infection that we can't really name. But just occasionally, it could be that this is a viral infection called herpes. Have you heard of that?
Isn't that an STD?
It can be an STD, yeah, but it doesn't have to be, OK? And I'm just wondering whether it would be helpful just to rule that out.
Just to understand you, because I haven't been actually sexually active for about 8 months because my girlfriend has long-distance relationship.
It's probably nothing to do with sex, this, OK? So there are two sorts of herpes.
Right.
There's genital herpes, and then there's herpes, which is just like really bad cold sores.
Right.
OK? And that is probably all it is, but it's really bad. So I think we need to
do something.
Investigate it a bit more. OK, it's a little bit of a rough swab, so it makes it a bit sore. I'm sorry.
No, as long as it helps you find out what's wrong, I'm cool with it.
If you could lower your lips down, I'm just going to do it along here, because you've got quite a few examples there. OK, that's great. That's done. OK, so that will take a few days to come back. If it's negative, then it hasn't really progressed us as to why this is happening. But some people do get terrible mouth ulcers.
Yeah.
And there isn't very much that helps with mouth ulcers.
I've got 4 gels which I'm constantly using.
The problem is that as soon as you put them on, your mouth washes them away. If over the next week or two it's clearly just getting much worse and you're suffering a lot, then just come back in. OK?
Doctor, thank you very much.
That's all right. Good.
See you later, ma'am.
Yeah. Bye now.
Michaela Farrell, please.
I'm so sorry I missed it this morning. I wrote down the complete wrong time. Oh, God. Thank you.
How are things?
Yeah, same. How's my x-ray? Same?
They're normal.
Yeah, I thought so. The tablets aren't doing anything. I really kept on with them and the side effects were fine. They went down.
The pregabalin?
Yes.
Yes, yeah.
And it's just still got this bloat and then this twisty kind of pain. I don't know what to do.
And how often does the pain come?
It's always there, just hanging around in this little patch. Like, I just don't know what to do now. Last week's been quite bad.
Right.
I haven't really slept.
What do you want to do you think?
I don't know. I did some kind of... I know there might not be... Sorry. Oh, God's sake. I'm just fed up and I just want this pain to go.
Yeah.
I can't do it anymore.
I mean, do you think the bloating is a big thing?
Yeah, massive. I'm so sick of it. I just look like I'm pregnant sometimes. Like, that's not... I never had this issue before.
Okay.
Something weird is going on. I don't know. Ugh.
Hey, how's it going, Mum? Oh, hey. So I came here like a few weeks ago because I had like a problem and it felt like there was like a lump in my throat whenever I was trying to breathe in. And I'm not too sure if it's all connected, but like you see last night I basically couldn't get any sleep at all because I've got like this mad stabbing pain here. And then it sometimes can feel like a sensation up here. I got given omeprazole and another thing, and maybe cooled it off a bit. But because like I've run out of that now, it's kind of like starting to get this neck sensation thing again.
So the problems up here have been going on for a few weeks.
Yeah.
Better with the medication to some degree.
Yeah, so like...
And then that's finished.
Yeah, to be honest, it's like last night I had like an episode, I'd say, where it was really at its height and I could really feel it. I guess that's been able to suppress it to some extent, I guess.
Do you smoke?
It's maybe smoke twice at night, usually, do you know what I mean? Like, that's it, I don't really smoke during the day.
Alcohol?
I don't really drink that much, to be honest. I'm not really a big drinker at all.
Caffeine?
Coffee a lot at work. Like a lot of coffee at work, actually, I guess.
Let me examine you.
Right.
So we're going to start at the top by looking in your throat. Say ah.
Ah. Ah.
It all looks normal in your throat. Now let's lie you on the couch and examine your tummy.
Right.
If we lift your shit up.
Sometimes, like, when I was lying down last night, they'll just feel like a pain there, like, do you know what I mean? And you're moving about. And like, even if I move, like, sat up like this, I'd be, like, aware of, like, oh, this kind of...
OK, perfect. There's a good chance that the two symptoms, the odd feeling up here and the discomfort down here, are interlinked.
Right, yeah.
What most commonly interlinks those two things is stomach acid. So sometimes when you get excessive acid production, it's uncomfortable around where your stomach is.
Yeah.
But also you get acid coming up and irritating your throat, and that can happen while you're awake, but also at night when you're asleep. The medications that you had, one of them was to suppress acid production. I think we should try a slightly longer course of the omeprazole. So rather than 2 a day for a short period, 1 a day for a little longer. Now, while you're doing that, I think a couple of lifestyle changes. We know that caffeine and nicotine are quite irritating to your stomach. Cutting out caffeine and trying to cut out the cigarettes will probably make a difference to the symptoms and allow your stomach to
get healed. Yeah, totally, that's OK. Thank you very much, anyway. Thank you very much for your time, man. Cheers. Thank you very much. Cheers, man.
It's important for us to think how many tests we're going to do.
Yeah, of course,
Because I think tests can be quite difficult for you. The more we go through them, they get more invasive as well. And there's more radiation and that sort of thing, which isn't good either.
Michaela is quite a new patient at the practice. She has sadly been suffering with pelvic and abdominal pain for approximately 3 years. She's been investigated quite significantly, but nothing has been found to help us work out the cause of her pain as yet.
You know, I think it's really reassuring that all your bloods were normal.
Yeah, that's good.
And your X-rays are normal, so it's good. There's nothing sort of.
There's nothing really bad.
But it's also really frustrating, isn't it, that we can't say, that's it.
Yeah, I know. So, I don't know what do you do now.
I think what we need to think about is helping you with the pain, really. If we got the pain better controlled,
definitely.
I'm not saying get rid of it. Yeah. What our aim would be to manage it better.
Okay.
And I wonder if we ask the pain clinic for some help with that.
Yeah.
Because pain is a strange thing. The pain pathways are really tricky, and it's how we feel in ourselves affects the pain, and it's a bit of a vicious circle.
Yeah.
You know, if we can feel quite low and stressed due to pain, and then that can make the pain worse as well.
Definitely.
So with the pain clinic, they haven't got any different medicines than what we use, but they look at it in different ways.
Okay.
So what are your bowels like? Do you have any diarrhoea at all?
No, never have diarrhoea. If anything, it's not like constipated, but like it will usually be every day or every other day I'll go, and then sometimes it will feel like it's not quite out, like I don't know. It just feels heavy and just, I don't know.
Okay. Why don't we try some fibre gel?
Okay.
Have you tried that before? No. So it's a sachet, it comes, and it's just a fibre that you add to some squash or juice or water. I mean, I still do wonder if it could be an irritable bowel type thing.
Yeah.
Okay. And it just helps the stool go through a bit more easier.
Okay.
Okay. I think it's worth trying for a couple of months and see if that helps. Yeah. Okay.
Yeah.
There we go. Okay. So come and see me in a couple of months to see how you're getting on with this. All right, and I'll refer you for pain clinic in the meantime.
You.
All the best. Bye-bye.
How can I help?
It's about my leg. I want to see if anything can be done about the scar. Because it's quite hideous. And all down the back is just hanging there.
Yeah. How's the sort of numbness in that foot? Is it about the same?
Yes, I've got no improvement there. It's still numb.
And the operation was back
December
15.
15.
Yeah.
Yeah.
So the level of numbness, has it got any better or is it about the same?
It's still the same as when I had it done.
So I don't think that's going to change.
No.
Lorraine has a complex past medical history. At the age of 51, she was diagnosed with a lymphoma. During the course of having chemotherapy, she developed a clot in her right leg. She then went on to develop what's called compartment syndrome and an acute ischemia of the leg. What that means is that the clot expanded and she had to have an emergency procedure called a fasciotomy, whereby you literally slit things down in the leg to release the pressure. And it's an emergency situation, otherwise you're at risk of losing the leg. But you did have a bit of what we call foot drop after the surgery.
Yeah, I still got foot drop, but before I couldn't even lift it up.
No.
You know, I've now got control to.
You seem to be walking more easily than
It's a bit
before.
easier to walk, but I can't walk very far at all.
Well, look,
But
it's
I
got
think I've
better,
given- I've-
hasn't it?
yeah, I think
From
I've
what you
given
were
it.
going through, look how far you've come.
Oh, yeah. I mean, I couldn't even walk in the beginning. Now I can walk a little bit. Yeah.
When's your next haematology appointment?
Next Friday.
And are they happy with everything that's going on?
Yeah.
They're just monitoring you, aren't
Yeah, I go every 4 months now, so
they? Okay.
I hope just every 4 months. That's all I want.
What are you hoping that they do?
I'm just
improve the appearance.
Yeah, because all this flesh here is just so loose.
Yeah.
I was wondering if maybe something could be done for it to be brought together, because I don't really want skin grafts after what I went through with the last one.
Do you moisturise the skin?
I do. I use bio oil on it, which they say for scars,
Yeah,
don't
and just
they?
general moisturising.
Yeah, I use moisturising creams and I use bio oil on the actual scars.
Okay. It's a difficult one, Lorraine, because firstly this becomes a cosmetic issue.
That's what I was wondering.
Which, secondly, with your medical history and with the tablets that you're on,
Yeah.
I don't think anyone will want to go near you unless they have to. I'm being completely honest.
Yeah.
And I'm not sure there's much that can be done there. If you open up other scars, you create scars on top of scars, and it doesn't really help it.
Yeah. I mean, would anybody be prepared to see me to discuss it, do you think? Because it is ugly, isn't it?
Firstly, on the NHS side of things, we'd have to apply for funding for you to be seen, and I don't think we will get that.
Yeah.
Because I'm not sure that there's much that we can do. On the whole, cosmetic surgery is not funded by the NHS. There are certain exceptional circumstances whereby a committee looks at the evidence provided to make a decision on an individual basis. So, for example, if somebody is suffering from severe emotional and functional impairment as a result of their disfigurement, this may be looked at in a different way. I can discuss it with a colleague of mine.
Yeah.
If you're happy for me to take a picture.
Yeah.
Is that okay?
Yeah, that's fine.
It's nice to see you smiling as well.
Yeah.
You're happier in yourself, I think.
Yeah, oh gosh, I've come a long way.
You have come a
Yeah,
massively
from
long
what
way.
I was, because...
So leave that with me, so to speak. But I can't promise anything.
No, OK, that's fine.
Are we supporting you enough? Do you need any further counselling with what's happened, or you do feel you're happy?
No, I'm OK. I've had loads of counselling. I'm not on antidepressants anymore. I mean, I still get down days. Of course you do, but I think anybody who hadn't been through what I've been through gets down days, don't they? But
I think you're
on the
an
whole,
inspiration, actually, of how well you've done.
on the whole, I'm not doing too bad. I don't work, obviously, now I've been retired. I just try and keep myself busy.
OK, we'll leave it at that for today, if that's OK.
OK, yeah, that's fine.
Nice to see you.
Yeah, and you. Thanks very much.
All
Thank
right.
you.
Bye-bye for now.
Bye.
Robert Bees, please. Hello there. Hi there.
Hello, all right.
Robert, you're looking uncomfortable.
Yeah, it's my legs still playing up and my back. I went to see Sebaceous.
Yeah, these are the nerve conduction studies, aren't
Yeah,
they?
they'd done all that, and they said they was going to write to me, and I haven't heard nothing.
No, OK, I have to say I haven't heard anything either. I'll write to the neurologist and say, look, it looks, you know, this chap's had all his tests done.
Yeah.
They did the electrical tests on your arm and your leg,
They've
did
done
they?
it on my arm and my leg, yeah.
Yeah.
Just down in the dump still, really.
Well, you are, aren't you?
Yeah.
Let's talk about that, because that might be more important even than the pains, isn't it? So I saw, since I last saw you, I gather you were evicted from your parents' council house, is that right?
Yeah.
Where are you living now?
I just stay with my sisters.
Yeah.
4 days a week.
Okay.
And then I just stay with my daughters just on the weekend.
So is that the long-term plan, or are you trying to get something else?
I'm trying to get somewhere. I went for a property and they said I was unsuitable.
You're not in work now?
No.
No. How's it working out, staying with your relatives?
Not very good, really. But I've got nowhere else, so just got to do that.
Yeah. And you're looking very down, and you said you feel quite down.
Yeah.
Tell me about that.
Well, it's just the loss of mum still going to me.
Mm.
And my sister and my dad.
Mm.
Just everything's just getting to me at the moment.
Mm.
Come on in, have a seat. I'm Dr. Graham.
Hello. So last time I think had a water infection.
Did I?
I think this is a cyst, and I think it's getting infected.
Okay.
It has been once before, and Dr. Lee said she didn't want to cut it out because it's right on the jugular. But over the last few days, it's hurting.
Yeah.
It didn't hurt last time, but it is hurting.
And has it changed as well as being painful? Is it bigger or?
It's bigger and harder, and it feels a bit warm.
Okay.
But I just know it's just... No, I feel a bit sicky, but I don't know if that's just... I don't know. I've got a job interview tomorrow, so I don't know if I feel sick because of that or if it's because of that.
Yeah, OK.
But last time, not at all did it hurt, and it just oozed horrible pussy stuff.
And nothing's come out this time?
No.
OK.
No, so I don't know.
Should we just take your temperature first? That's fine, 36.1, so that's normal. Just take your pulse. What's your job interview?
I work in a school anyway as a teaching assistant, and it's in the same school but for a different teaching assistant role.
OK.
So yeah, I'm just a bit nervous. It's ridiculous.
Do you want it?
Yeah, I just think it's horrible when you work there and you have to have an interview with people you know. Yeah.
Difficult, isn't it?
It is horrible.
Okay, let's have a look. I'll just put some gloves on.
Okay.
Yeah, it has got a little head on it, hasn't it?
Oh, I don't know, has it? Okay.
Little white bit.
Yeah, so maybe it is then, because it doesn't usually have a head on it.
Yeah, that's how big it is. And it's a bit red up there as well.
Yeah. And that is sore when you touch
so
it.
I don't think you should try and squeeze it.
No, I won't.
Okay?
No, I won't.
And
no.
hopefully it'll get better with some antibiotics, which I think is what we should do. Yeah?
Yeah.
So we normally give 5 days of flucloxacillin, okay?
Yeah.
4 times a day. And if it's obviously getting worse, then you come back. Or if you feel ill, like you're being sick or something. It's basically a sebaceous cyst, which is part of the hair follicle that's got a bit blocked and caused a lump, and then that is prone to getting infected. So it's really common and not anything surprising, to be honest. As this is the second time it's happened, you could discuss with Dr. Lee whether she'd be willing to remove it. But I can see why she's a bit reluctant.
She's a bit anxious about that, I think, and that's fine. I don't want to,
Well, you don't want
it's
things
a bit risky. Yeah.
Exactly. Is that all right?
Yes, of course. That's absolutely.
And good luck tomorrow.
Thank you very much.
That's all right.
Fingers crossed.
Yes. Bye bye now.
Thank you. Bye bye.
Had you thought about if there was anything I could do to help you?
Well, you give me this letter to ring up about when I was down in the dumps before.
For the get some counselling.
Yeah. They rang me back and said I can go to a meeting.
Yeah.
Which I went there and they was talking to me and everything like that. And they give me the number. They said any time you just ring. So.
I think it would be worth you ringing maybe and asking for some one-to-one counselling.
Pain her now with that lump as well.
Yeah, okay. Let's just stick with your mood for a second because I don't want to lose this opportunity to talk about that really.
Yeah.
So these were the people you rang, wasn't it? Bristol Wellbeing Therapist.
Yeah.
I would encourage you to give them another ring actually.
Right.
That's the number.
Yeah.
And say that you went to a group session before.
Yeah.
That you're very down in the dumps and that maybe some one-to-one counselling would be helpful, and they'll take that on for you.
Yeah.
All right, so I'd encourage you to do that. Are you still taking the antidepressant that you were prescribed by my colleague?
Yeah.
Can I suggest if you've not had side effects, but obviously you are still quite depressed, maybe we should put that dose up to 100 milligrams and see. Okay?
Yeah.
You're probably running out of it fairly soon, actually, aren't you?
Yeah.
So I'm going to give you a higher dose of the antidepressants. So I'll put a prescription for some of that through to the pharmacy next door. You're going to contact those people. I'm going to write to your neurologist. There we go. All right.
Yeah.
I think that's covered enough for today. But I'll come and see me again in a month.
Okay, make an appointment for a month's time.
Bye-bye.
Right, thank you.
Kay Frankson, please.
Hello.
Good morning. I'll have a seat.
Thank you.
I'm Dr. Jewell.
Hello, Dr. Jules. I hope I'm not wasting your time, but it's just people keep telling me to come and see you because I've got this mysterious mole that's suddenly appeared at the back of my knee.
So let's ask the standard question. Is it bleeding?
No.
Itching?
No.
But it's new?
It's new and it's...
But you don't, because if you have many moles...
No, not really.
The average number is 40.
Is it?
Yeah, so most of us have got a collection.
Oh.
So let's have a look at it.
It's this one, so it's at the back of my left leg.
At this point I have to do something which is fraught with risk.
Oh, hello.
Get down on my... Is it this thing here?
Yes.
Okay,
Well, there's a cysty thing as well.
Have you looked at them?
I can't see them
so
really.
which is the one that everyone's worried about?
The one that's actually coloured and looks like a mole.
Well, they've got 3, 4 of those.
Oh, well, there you are. You see, I can't even see them, so I didn't know.
These are obviously, quite obviously, warts. Because what they're doing...
That's horrible.
Look, what they're doing is when you bend your knee, you're spreading them. I think the sensible thing to do is to take a photograph of them.
I've done that. I did it the other night to have a look because I knew I was coming to see you.
you know, check it again in a few months' time.
It's quite hard to take, actually.
Oh, I'm not suggesting you. Surely you can get somebody else to take it, can't you?
Could do. Hello, would you like to take a picture of my mole?
I don't really have any other suggestions because they look completely normal.
Okay.
All right.
All right. So that's it then.
Yeah. And do come back if you're worried. You know, whatever you do, don't let concerns about wasting anybody's time deter you. That really, you know, this is a 5-minute business. It will take a bit longer, but
all right.
It's not a big deal at all.
Okay. Well, thank you very much for reassuring me.
Good.
And have a nice day, as they say.
Bye-bye.
Bye-bye.
Catherine Bowers. Come and have a seat. I'm Dr. Barnard. I don't think we've met before, have we?
Before. Basically what it is, I'm a diabetic.
Yes.
And I got I got a blister to my little toe and the next toe.
Yes.
Underneath, and I think it's got infected. Because it's really sore, I can't walk properly, and there's like a red line just starting to go up there. It's not the first infection I've had in my feet before. It's...
Oh goodness, that looks
really
quite nasty, doesn't it?
Yeah, it's very sore.
How long's it been going on for?
It's only started getting red and swollen past 2 days, and that line just showed up this morning, but it's been sore for a week.
Right.
But I didn't think it was infected because I kept it clean and stuff like that.
Yeah.
But it's just, I think my toes swollen as well, and that line's coming up, which is worrying me a bit.
And are you under podiatry or anything like that? Have you been in the past?
No, because I don't like people touching my feet. I hate it.
Okay.
I can't bear people touching my feet.
Can I have a look?
Yeah. I mean, it must have been the one on this toe I left a bit too long and it got very nasty.
Pull that toe back for me.
This one?
Yeah. It's really painful, isn't it? Put your foot back down again. Fine. Okay. That looks really sore.
It is sore.
Because you've got the diabetes, we have to be really careful, because you know if we leave foot infections untreated or not properly treated in diabetics, it can be quite serious.
Come on in.
Thank you.
Have a seat. How can I help?
It's my right kneecap.
Okay.
I'm all right doing long walks, but when I stop, it seizes up.
Right.
And I have to let it rest for a while before I can... And if I start walking it straight away, it hurts.
Yeah.
I can kneel down on this knee, but I can't put this knee down properly.
No. Can we have a look at your knees? Do you want to just pull up? And could you do that with the other one as well, just so I can compare them? That's it. You can see that it's a bit swollen up there, can't you? And if I just have a press around that side, that's okay?
Yeah, it's fine.
Round here? Does it actually hurt if I press there?
No.
Okay. And if you fully straighten it, does that hurt? No? Bend it? Straighten it? Well, that's pretty good, isn't it? And if you just move your knee just so that your ankle's there, and I'll just give it a bit of a test. It's quite stable, isn't it? Yeah. Good. OK, you put your trousers back down then. Your knee is taking quite a lot of weight at the moment because it's the main joint that carries you around. Have you had thoughts about losing quite a bit of weight at all? Any thoughts about I mean, I think it would really help with what you're here for today.
Think about trying the Weetabix diet.
The Weetabix diet? So what's that one?
Just Weetabix 3 times a day and that's it. And
Really?
then you play with your fruit.
Right. Sounds a bit crazy to me. What do you think about it, really, the Weetabix diet?
I think it's all right.
Yeah? I mean, do you know how people successfully lose weight?
Well, you've got to mix the exercise and the healthy eating.
Yeah.
sides.
Most of losing weight is simply eating less. So I actually say that most people who successfully lose weight just say, I'm going to change the way I'm going to eat for the rest of my life. Because a lot of people do these diets, like a Weetabix diet, and unfortunately, when they go back to what they normally do, they just put the weight back on. So sometimes I suggest to people they just reduce the quantity, because quite often, quite a lot of us are eating more than we need to.
I don't really have breakfast. Sometimes I have lunch.
Yeah.
But I do have for dinner.
Yeah. People who eat breakfast are in general thinner than people who don't. And people who eat a small regular meal 3 times a day are lighter than people who don't do that. Your body is sort of needs regular eating. We all eat our main meal in the evening in this country. And the problem with that is that we're having a lot of calories and then we go to bed. And actually, when we need the calories is the morning and the lunch, and much less in the evenings. If there's any way that you can change that around and have your main meal at lunchtime, that's supposed to be healthier.
Okay.
If you wanted some more help about losing weight, then you could book maybe to see one of the practice nurses or something along those lines.
Okay.
Is that all right?
Yeah.
Okay.
Thank you for that.
That's all right. Nice to see you.
Nice to see you.
Bye now.
Bye-bye.
Can I touch your feet to see what the pulses are like?
Yeah, both feet.
If it's too much.
It's okay.
Is that very sore?
Yeah, that is, yeah.
Okay. Patients with diabetes are at increased risk of having problems with their feet. This is because the diabetes may reduce the blood supply to the feet and may affect the sensation. This means that patients may not notice when they've got a sore foot or an injured foot. If it is not treated promptly, the patient is at increased risk of having a serious infection and ultimately, in the worst cases, at risk of amputation. What I'm going to do is I'm going to give you some antibiotics. We're going to get you booked in with the nurse to get it dressed and things, and then I'm going to have a look at referring you to the diabetic foot clinic.
Okay.
If I do that, will you go?
I promise you I'll go, because I don't like people touching my feet, but I don't want to lose my feet either.
More than anything, we need them just to look at it, keep an eye on it.
Thank you so much.
So look out for the appointment, but if there's going to be anything different, and they're just going to give you an appointment straight away, I'll ring you.
Thank you so much. Thank you.
Okay, bye.
Bye.
Mr. Thomas, please.
That's me.
Hello. Sorry, you've waited a little bit there.
That's all right.
There we go.
Thank you.
Right, do have a seat there. Hello.
Cheers, hiya.
Hi, I'm Dr. Bolam. All right. What can I do for you today?
Well, it's been coming on about 3 weeks now, this lump. It started off, well, didn't even notice it really, and then gradually, it's not got any bigger. It kind of, if anything, spread slightly.
Yeah.
It's just fluid, I guess,
Yeah.
but I thought I'd leave it a few weeks and it'd probably go away.
I know exactly what that is.
Right, yeah.
Okay, it's a bursitis. Okay.
Yes.
So we all have fluid-filled sacs around our joints called bursae.
Right.
Okay, which can get swollen all of a sudden, okay? Usually caused by repetitive trauma. So that one there, people get them on their knees often. Anybody can get it.
I got you.
So that's an electronon, that one, over the outside of the elbow. All right? Is it painful?
No.
No, not painful.
Maybe if you put pressure on it, like lean on it or something, it might be annoying.
They can get infected, but it doesn't look infected, so we don't need antibiotics,
Oh,
all right?
Okay.
Usually, the first line is to take an anti-inflammatory,
Yeah.
right? Get something to compress it, so go and buy yourself an elbow support from the chemist, all
Yeah.
right?
Okay.
Put ice on it, and it usually just goes away, all right?
Brilliant.
And only if it gets red and hot and horrible do we need antibiotics, and we're not at that stage at the moment, certainly. All right? Yes, have a little read of this.
Yeah, sure, thanks.
Tells you how to treat it.
I lost a wife coming up 5 years August, and seeing her in conditions that she was in, it does tend to make you...
Yeah.
I mean, I don't come to the doctors very often at all, but it suddenly... you think, well, one thing, keep on top of
yes,
it, you know.
I can absolutely assure you that's nothing.
Ah, lovely.
100%,
All right.
actually.
Thank you very much. For
All right,
putting my mind at
okay.
ease.
All right, okay.
Thank you, doctor.
Okay, have a read of that.
Yeah.
Do what it says.
Yeah, thank you
All
very,
right,
very much.
Is that okay?
Yes, thank you,
All right,
doctor.
okay.
Cheers now.
All right, have a
Bye-bye.
nice day. Bye-bye.
Bye. It's all right, I got a bit of OCD as well, don't worry. It's not worth talking about, I just handle it.
All right. Okay.
Bye, thank you.
All right, bye-bye.
Bye-bye. Bye.
Thank you, have a nice day.
And you, bye.
Thank you.
Bye-bye.
Bye. Do you feel better now?
Yeah, I feel better. You gonna say bye now?
Yeah.
Reluctantly. See ya.
Hi.
So what's been going on then?
I just, last couple of weeks, I just get really bad headaches.
Oh dear.
And this morning I woke up with a really bad one.
Right.
This morning.
And what's been causing them, do you think?
I don't know, but I'm on tablets for...
He's got ADHD and he's on concerto, which is quite a high dose.
Right.
But at the moment, it's hurting his eyes as well, and underneath his eyes and all down here.
Right. Whereabouts in your head are they?
Just like, just all over.
All over. And,
yeah.
And it's been there for 2 weeks on and off, or is it there all the time, or what's it
Like,
like?
sometimes at school, like if I'm reading or I'm looking at the board, like for a lesson,
Yeah.
it hurts. Or like sometimes before football, if I'm hot, or I get them like randomly sometimes.
Okay, so when it's hot, it's worse. When you're reading, it's worse.
Yes.
It's been on and off in the last 2
Yeah.
weeks, and before that?
You've had them for a while. I've had them for a while since I've been on my tablets, but I don't know if it's my tablets or not.
How long have you been on your tablets?
A couple of years.
Oh, I see. So you've actually had headache for a couple of years
Yeah.
into the tablets. It's just it's been worse in the last.
It's worse, but the last fortnight has been really complaining a lot.
Right then. So you're going to Nepal, is that correct? Yeah. Okay, and going for 2 weeks.
Yeah.
Volunteering. Yeah. And what exactly are you going to be doing?
I'm renovating a school.
Oh, okay,
Yeah.
fantastic. Excellent. So you said already that you need your tetanus and typhoid. Also hepatitis A. You need to be careful. So we'll quickly have a look through. It might be easy if you come round.
Okay.
A little bit. So the hepatitis A is spread through food and water and shellfish, you see, and person-to-person contact. And then typhoid, food and drink again, tends to be food and drink and hygiene, personal hygiene. And rabies, obviously. Any stray animals resist the urge to stroke them. Even if you get a scratch or a bite, do go and get checked immediately. Make sure you're okay. You happy to have your injections today?
Yeah.
Allergic to anything?
No.
No chance of being pregnant?
No.
Not breastfeeding? No. Lovely. OK, we've checked all our safety questions. I just need to take your coat off so I can put it in your arm. If you've got any queries or your things change, you can look on a website called Fit for Travel. Okay. It's like the sister site of what we looked at.
Okay.
So it's got the same maps and everything on there.
Okay,
All right.
cool.
So this is the hepatitis A, OK? Sharp scratch. There we go. Right, sharp scratch. Right, and that's your typhoid. Make sure you're not bleeding. Right, come around the other side, and this will be the triple one. So, sharp scratch. All done.
Have you got any other symptoms going on?
No.
No weakness or numbness? Your arms and legs are working normally?
They're a bit achy today because I played football yesterday.
He was in a tournament yesterday,
Oh, all right.
so
Did
he
you
played
win?
football all day.
Oh, no. We lost
No.
in the quarterfinals.
Oh, that's a shame. Never mind. Put your arms out like that. Close your eyes. Squeeze my fingers. Pull me towards you. That's it. Well done. Push me away now. You can open your eyes now. Push, 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 push. That's great. Have a seat. I want you to follow my finger. Just no double vision at all.
No.
That's good. Can you feel me touching you here?
Yeah.
All feels normal. Open your eyes really wide. Close them really tight. Show me your teeth. Blow your cheeks out. Give me a cough. Shrug your shoulders. Stick your tongue out. That's right. I'm just checking all the nerves to make sure they're all working okay. Right, I'm just going to shine this light in your eyes. Lovely. That all looks nice and normal. You said your vision's okay?
I can't read, like, so far, like, I can't...
Oh, I see. So it is a bit blurry on far vision.
We put it first down to the medication.
Yeah, well, of course, those tablets might be the culprit, mightn't they?
Yeah.
OK, well, I think I want you to have an eye test. And I want to reassure you that examining you, it's all completely normal.
Yeah.
So I don't think that there's anything more serious going on underlying all of this. I think probably it will be that the eyes are the culprit and that's the trigger. Have you got any painkillers? Have you tried anything to help?
Painkillers help.
We take paracetamol as usually I give him.
OK, because it may be worth trying some ibuprofen on top and we'll just
Okay.
see what that's doing and then I'm going to
Yeah.
get you back in to see Dr Bolam next week.
Okay.
But if things get worse, then we'll see you again.
Okay, well, I'll go and book his eye test now. Thank you ever so much. What did you say,
Bye
Logan?
Thank you.
Good boy, bye.
Melissa Sargent. Hello, hi there, come on in.
How are you?
Very good, thanks. Come and have a seat here if that's all right. It's a little bit sort of crammed. Is that all right? What can I do for you?
So basically, I have a IUD inserted. It's been in for about 2 years, but I've been getting really bad cramps and pain when I'm having like sex. I can feel it in the top of my like cervix, and my period's been ongoing for about 2 months now. So it was about a week ago that I started feeling pain there.
Okay. What I wonder is, has it moved?
Yeah.
Has it come down a bit? Do you feel like it might have done? Is that what you had in mind?
Yeah, because I'm not sure what else could kind of... I'm normally really regular with my period.
So what I'm going to do is see if it's sitting down in the neck of the womb.
Okay, sure.
Not terribly pleasant, but it's not terrible. So I'm going to get you over lying on here, and you're going to need to take all your bottom things off, I'm afraid. But it's warm today, so that's not,
it's
not a freezing day. So what I've got is the speculum, you know that
thing they used to put it in,
and I've also got some swabs, because sometimes funny bleeding can be caused by an infection.
Yeah, okay.
So I'll just check you for chlamydia whilst we're about it. Yeah. And if there's any discharge, I'll take this swab as well. So it's a couple of swabs. Oh, so bend your knees up for me. Is that all right? First thing I'm going to do is I'm just going to feel the womb and see how everything is in there. Just relax a bit there, take some deep breaths. That's great, well done. That's all. OK. How's that? Yeah, sorry. You can get up and go, you all right?
Yeah.
Very good. If you like to get up and get dressed. So, 2 possibilities, well, 3 actually, I suppose, that we have to think about.
Okay.
One is that you got pregnant. I don't think this is likely to be the case with the coil in, and it's causing funny bleeding. So I think we should do a pregnancy test.
Okay.
The next is that the coil has slipped.
Yeah.
And that actually we'll have to take it out. And then the third is that you've picked up an infection of some sort that's causing it all to be sore.
Okay.
The question is really, are you sexually active?
Yeah.
Because if you are, and not using condoms, that is always a possibility.
I've had the same boyfriend for, like, more than a year now.
Yeah, so it's very unlikely.
Yeah.
The coil's a good option for Melissa because once it's fitted, it's sitting there doing its work without Melissa having to do anything about it. And this makes it much safer than other sorts of contraception, such as the pill that you have to remember to take every day, because however good you are at that, sometimes you're going to forget. The coil might not be for everyone. For example, if you have more than one sexual partner, you will be exposed to sexually transmitted diseases, and the coil can transmit those diseases up inside the uterus and into the tubes and increase your risks at a later date of infertility or of pelvic inflammatory disease. And then we're going to need to see you again in a couple of days' time, probably. Is that all right?
Yeah, no, of course.
Callum Chick, please. Hi, Callum.
Hi.
Yes, obviously I've seen you before, so I sort of scooped you out there because I know a bit about what's going on. But we're not really getting on top of this, are we?
No.
When did this start? How long ago did this all start now? It's been going on
probably about 3 weeks, maybe.
And you had a definite water infection at one point, didn't you?
Mm.
Yeah? And you had the right antibiotics and you took the full course?
Yeah. My mum says she thinks it might be a kidney stone.
2 thoughts about that, OK? The one is you definitely did have a urine infection 2 weeks ago. You had bacteria in your urine, which isn't a stone, OK? Yeah. A kidney stone tends to just give you blood in your urine. I have got blood in your urine, but you've also got white blood cells and you did have bugs, bacteria, OK? So the question for now is whether we treat you with antibiotics, whether you start them now or whether you want to wait and see what your symptoms do and wait for the result.
I could wait till Monday, just maybe take paracetamol.
I mean, I could give you the prescription in case it gets really bad over the weekend, but you don't take them unless it gets really bad.
I think that might be better.
I think what we might do, get you to have a scan of your kidneys, just to make sure that there's no underlying problem causing you to get recurrent infection.
We haven't really had a working toilet for a while, like a month.
You haven't had a working toilet? Have you survived without a toilet?
Just buckets.
Buckets?
Yeah, just have to get the water and flush it.
Oh, I see. Oh, I see. So your peeing and pooing in the toilet.
We only just got it fixed like a couple of days ago.
That's all right.
No, so it's not unsanitary.
No,
things.
that's not unsanitary. No, that's all right. That's okay. It's only the flush that's not well. I thought you were going in your garden or something.
No.
I know. OK, so just keep that and don't use it unless your symptoms get worse. Yeah?
Thank you.
OK. All right, any questions you want to ask me?
Just maybe cutting on my drinking. How would I cut down on my drinking?
Do you want to come back down and sit down for a minute? How much are you drinking?
I drink a lot, but I'm not drinking like 2 bottles of wine a night or something. It's just like, the most I think is probably about 24, but that was about over like 4 days, 5 days. So.
24 what?
Pints.
Pints of what?
Beer.
Pints of beer. So you drink beer, that's pretty much all you drink. You don't drink wine or spirits?
No, like, if I go out in town or whatever, I will, but I hardly go into town. It's just to the pub.
OK, so in a typical week, how many nights do you go to the pub?
I go on Wednesday, I'm going out tonight, and then probably end up going maybe Saturday or Sunday.
So sort of 3 or 4 nights a week in the pub?
Yeah.
Is that right?
Yeah.
And how many pints?
2 or 3.
2 or 3 pints?
On a...
3 or 4 times a week?
Yeah.
Healthy drinking is a really important part of our social fabric, and people need to enjoy alcohol, but enjoy it responsibly. If a teenager gets into the habit of drinking heavily, if they continue this into their older adulthood, this will lead to problems with their general health. So people need to think about their drinking habits and try and establish good drinking habits from early on. So that's 6 units. 6 also, so that's 24. So you are drinking more than the recommended amount at your basic, OK? Is it causing you any problems? Do you feel terrible in the mornings? Do you feel guilty about it? No violence between you and your girlfriend or anything like that? Do you think it's a problem?
Now I am, but before I didn't.
If you're recognising it as a problem, it's from what I'm hearing from you, you can cut down. It's not out of control. You have some nights off. You have several nights off a week.
I can cut down. It's just like things like parties and going to see my granddad.
Why don't you try and go to the pubs like often? Why don't you talk to your granddad about him having something else in that isn't beer?
Yeah.
You go to your granddad and have a cup of tea? Sort of strategies like that, isn't it? Or just having shandies, or is that too...
No, I can drink shandies.
Yeah? Well, if you drink shandies, you halve your intake.
OK.
All right?
I could do that.
Is that all right?
Yeah, that's fine.
You come back and talk to me again if you want to.
OK,
Or Dr. Graham. OK? Is that OK?
Yeah.
There is services that we can offer to help you, but I'm not sure you need that right now.
OK.
OK?
Yeah.
Is that OK with you?
Yeah.
Yeah.
OK, thank you.
All right.
Good morning.
I've got an appointment at 10 to.
OK. Who are you seeing?
I don't know, my mum made the appointment.
OK. Is it a doctor or a nurse, do you know?
I think a doctor.
Doctor. And your name is?
Francesca Clark.
OK, let's have a look. Yeah, it's the duty doctor, Dr. McLaren.
Okay.
Yeah, I've booked you in, so if you take a seat, I'll call you in.
Come in, have a seat.
Thank you.
What's been happening?
So I was just taking a drink and I felt it was like a bit weird when I swallowed.
Today?
No, this was a few days ago, but I only managed to get here today because I had to go down to Plymouth to take an exam.
OK.
But it's just really swollen.
OK.
And gross.
So 3 days ago, sore throat, swollen.
Yeah.
And gross.
Yeah.
OK. How do you feel? Do you feel today? Do you feel like you got fever at all?
I don't think I have a fever. I just.
Are these from this summer?
No, they're from last summer. I've been really boring this year.
You and me both. I've not done much. 37.5.
I'm just going to Spain tomorrow or
yeah?
tonight. Yeah.
Nice.
So the rest of my family are already there.
OK, head back on that. Oh, yeah. Yeah, they are gross, aren't they? I think you might have a bit of an abscess going on there. It looks like it's possibly. I'm going to get the doctor to come and look at that because I've not seen one like that before. Okay. And I've looked at a lot of gross tonsils.
Yeah.
Ask Dr. Cordell to come and have a look.
So I've been documenting it. So that's it, like, last night.
Oh, right,
when it
OK.
started.
Let me try and take a photo again for you.
Yeah.
I'm on pen touch and you've got another one. Especially if you're going away tomorrow. Deep breath in. Yes, you can't really see it very well, but it's this bit here that I'm worried
like
about.
poking out the back.
Hi, Lizzie. Sorry, I get you've been trying to get hold of me.
That's all right. Okay, I just want you to look at this tonsil because I was just saying, I've looked at a million tonsils and I know what a bad one looks like, but I've not actually ever seen one that looks like this. To me, it looks like it's sort of like burst open or something.
Okie doke.
Doesn't look quite right. The only reason she's here is because she's going on holiday tomorrow to meet her parents in Spain, so that's why she's here.
It does look horrible, doesn't it? So we need to swab that.
Okay.
Okay. You get that appearance with bacterial tonsillitis. You can get that appearance with glandular fever, actually, but
It's a bit swollen there. But not too sore.
Yeah, you have got a gland up there, haven't you? And then let's have you.
Deep breath in.
Wait for Lizzie to finish.
You are so good at this. I'm
It's brilliant, actually.
Oh, I just smell them.
Yeah,
it does.
Yeah.
Yeah. So, of course, penicillin, and then because you have got quite a big gland up here, actually, book an appointment to see us once you're back, and we'll just check that that's going down and your tonsils are looking lovely rather than manky. Okay. Is that all right? Does that make sense?
Fine, thank
you happy with that?
Yeah, that's great.
Super. Can I go?
Yeah.
In the middle of a cup of tea when you called me out urgently. So I'm going to return to my cup of tea.
Okay.
Okay, have a good holiday.
Thank you very much. Okay, so I just need to get this signed. So if you have a seat in the waiting room, and I'll pass this back out to you. Have a good holiday.
Thank you.
Bye.
This morning, can I help? Do you know who you're seeing?
Dr. Barnett.
Dr. Barnett. And your name is?
Asley Williams.
It's the 15th of June.
What is it today?
It's the 7th.
Okay.
Or is it the 8th? No, it's the 8th today. The 8th.
So it's the same time, but next week?
Next week, next Thursday.
Cool.
Thank you. We'll see you then.
Come on in. Hi.
Hi.
Who have you brought with you?
My old dear.
All right.
Lovely way to be.
Yeah. Hiya.
Hello.
So what's been going on then?
I just don't feel like myself. I feel like doing some stupid things.
Stupid things?
I feel depressed, sort of thing. Like, I don't feel normal. And it's been affecting everyone in the house. And yeah, I just need help, basically.
Yeah, I'm sure. Tell me a little bit more.
Okay, so I don't know what to say. Like,
it's been going on since you were 15, really, hasn't it?
Yeah.
Okay.
Especially with the anger issues.
Yeah. Has anything changed? Has anything brought you down?
I feel like in my house, I'm just not wanted by anyone. I'm just on my own, sort of thing. I'm against, like, everyone's against me. I try to control my anger. As Mum said about like getting some wood and about gardening, get some nails, and just every time you get angry, just beat up the wood with some nails.
Yeah.
But that didn't even work because I get too angry and I black out, and then I just ended up punching it in my fists.
I'm sorry to hear all of this.
I just think about things over and over again.
What sorts of things do you think about?
Mum, like, don't love me. My dad, sisters.
Are they the people that are at home with you? Who's at home? Yes, you're living at home at the moment. Yeah. And are those thoughts about feeling low, are they there all the time, or are they just there at certain points?
It's been there. It's there. Like, I do feel low. Something happened yesterday, and it's just completely, like, I didn't want to be here yesterday. I wanted to kill myself yesterday.
Right.
I didn't, like...
What happened yesterday?
I can't explain it.
It's not for me to explain.
Come on in, come and take a seat. Right. What's on your mind?
I'm really stressed out and I get anxiety a lot because sometimes I just feel like life is always going against me and that everything is going wrong and that I feel powerless because I can't change anything.
What year are you in?
7.
Year 7. And everything okay in your sort of friendship groups and things like that?
Yeah, friendship group's pretty good. It's just my home life, which is kind of, like, weird, I guess. Because I live with my mum and my stepdad and my sister and my autistic little brother, Dexter.
And how do you find him?
He's really nice, but he's quite hard to cope with sometimes because he's so high demanding.
Okay.
And I worry for, like, my mum and other people. And sometimes I feel like with their stress, they sort of don't mean to, but they bring it into the house. And there's people snap at each other.
Yeah. There's been quite a lot of things going on at home.
Really a lot, yeah.
And you've had quite a lot to deal with, haven't you? Because there have been health issues in the family. which is adding to all of this. And that's what I think we need to also explore, is how your response to all of these other issues that have been going on. In terms of when you say that you feel a bit low or a bit anxious, have you self-harmed in any way at all or anything like that?
No. But when I'm really, really upset and feel like I have no one to turn to, I think it's more the thought of disappearing and not being there rather than actually killing myself.
And what's been really great is the way you've told me your symptoms. You're actually very clear in how you're feeling, what you need help with, and what we're all here to do is help support you. So counselling at school would be really helpful, because that's somebody who sees you regularly in your environment, you know, on a regular basis. I can see if we can get back into having a few sessions via CAMS, but it's getting increasingly hard to get referrals in. Leave that with me. You might find it helpful to just keep a diary, a journal, and just write down your thoughts. What's made you happy? What's made you sad? And what can you do about it? It just helps to clear the thoughts a bit. Does that make sense?
Yeah.
I'd like to see you back in a couple of weeks and see how that diary's going and how you're feeling.
That's cool. Thank you.
Good. Nice to see you, Archie.
Take
care.
Thank you.
All right. Bye-bye for now.
I thought that went good.
She's so lovely.
I know.
What happened yesterday?
Yesterday, we had a major row.
I'm sorry that it's upsetting. Would you like a tissue?
Yeah, that's...
So, sometimes these things are really difficult to talk about, aren't they?
Yeah.
What, can you tell me more about what happened yesterday? You said that you didn't want to be here and that you were even thinking about harming or killing yourself.
Yeah, it's just that I tried talking to people and like people just shout at me, and then again anger comes out, and I don't like being angry.
Let's just start at the beginning in terms of the things to be worried about. You mentioned that you were feeling really bad yesterday, and you got to a stage of worrying about whether you wanted to harm yourself. You said even kill yourself.
Yeah.
Are they thoughts that you've been having that we need to take seriously, or was that just something that happened yesterday and it's... You know, tell me more about that side of things.
Well, I've tried it before.
You've tried it before?
I've tried overdosing, but obviously I've took so many, and I've just eventually got drowsy and just dozed off.
Right.
So I just fell asleep, so I couldn't, like...
When was that?
Oh, it was a couple of months, like a year ago, 2 years ago. Something like that, yeah.
But you didn't talk to anybody about that?
It's the first time I spoke to someone about everything.
And then, do you think that is that at risk of happening again?
If I get too low, then yeah.
If you got to that stage and you were making plans or you were actively wanting to die, then that becomes an emergency that you need to talk to the crisis team for, and there's a special number that you can talk to get hold of the emergency mental health team.
OK.
I'm right in thinking that that's not what's needed now, though?
It's not got that far.
No.
It's not got to the point where I'm like...
Sure. Suicide is the biggest killer of people under the age of 35, and men are 3 times more likely to kill themselves. I think for all of us, it's a normal part of being a human being to wonder what we're doing here and to have existentialist ideas that mean that sometimes we wish we weren't. Of course, sometimes those feelings can spill over into being more serious suicidal thoughts. And if they do occur and are more deep-seated and pervasive, then it's really important that people go and see their doctor to start the ball rolling to get the support that they need. The crisis team, as I say, is the first number that I'm going to give you, and that's for if you get to a stage where you get that bad again. And there's also the Samaritans. I don't know if you've heard of them.
Yeah, I have.
They're a professional talking service. So for people who are feeling so alone that they need to talk to somebody, and that's what they're there for, 24 hours a day. OK, so there's always options of people to talk to.
Yeah.
And as long as you're able to do that, then that is going to make me feel safe about letting you go home at this point. Okay. Is that OK, from that emergency side of things? I'm going to give you some information about some counselling services that includes anger management courses and some CBT, which is about looking at new ways of thinking to try and help you move forwards with some of these issues. The most important thing is if you're feeling worried or you feel like you're not being safe, then please do something about it and talk to your mum about it, because obviously she's heard all this stuff and is going to be there to support you with this, and we'll move things forward step by step, all right? Yeah. Cheers, then.
Thank you very much.
Nice to see you. OK, nice to see you.
Take care.
All right, any problems, you just let us know.
Back.
That's fine, I'll sort it out in a minute.
Hello, can I help?
I cut my finger last night, and I wondered if it's more of a doctor's job or maybe a small hospital job.
Can do stitches here. Do you think it needs stitches?
See, I'm not medical professional. Do you know anything about this?
No, I'm not medically trained either.
No.
I don't do blood, I don't do me.
But, okay, I won't get out then.
Do you want to pop into the treatment room? There's a reception in there, so the receptionist in there is probably more able to sort of to see whether you just need it dressed properly or whether you need to go to A&E.
That's great. Can I just walk in?
Yeah, just go in, all right?
Come on in, have a seat. How are you doing?
I'm okay, yeah.
All right.
The British Wellbeing Therapy rang me.
Yes.
And said to talk to you about mood stabilisers.
So you saw them, I think since then you've had some one-to-one. Is that right, or you haven't yet?
I'm still on the list for the talking therapy.
Yeah.
But they can only help with the low moods. They can't help with the high moods.
Right. So in general, GPs don't initiate mood stabilisers. You go and see a psychiatrist or a mental health practitioner to have a fuller assessment to see whether there is a diagnosis that would mean that you would benefit from a mood stabiliser. Do you know what kinds of diagnoses they're thinking of?
They didn't really say.
And how much of the time do you think it is the low mood that's the issue?
It's kind of hard because if I'm... It's obviously like really, really low or it's really amazing, and when I get in that really good mood, I feel like I don't need any help at all, and I don't need anything.
Yeah.
But then when I go low, I think, why didn't I accept any help?
And when you feel absolutely fine, and better than fine, can you describe it a bit?
I'm either really irritable. I don't sleep. I feel like I have like 1,000 thoughts in my brain, but they're not like bad thoughts.
Yeah.
They're like really amazing thoughts, and I just feel really good about myself. I'm great, and I want to socialise constantly with people.
Okay.
Because normally I'm quite self-conscious. Like if I'm in a low mood, I'd be really self-conscious, have really low self-esteem.
And how often does that switch?
The low moods last longer. So they can last, they'll last longer than a week. So it'd be like more like 2 weeks. Sometimes I've had it like a month. And then the higher moods can last, I'd say about 2 weeks as well.
Okay. And have you looked it up and thought about what this might be?
I was thinking maybe bipolar.
Okay. Well, what I suggest we do is I'll write a referral letter to the community mental health team to ask them to do an assessment to see whether they think you have got a diagnosis that would be suitable for you to go on a mood stabiliser, as the Bristol Wellbeing Therapy Service have suggested. And I think whilst you're waiting for that appointment, it would be a good idea for you to write a diary of how your moods are, because it's quite useful, I think, for them to see how much it fluctuates.
Yeah.
Okay?
Yeah.
And you could also write down some of the thoughts you've got, okay?
Okay.
Whether they be low thoughts or high thoughts, yeah? And then that will give them a really good picture when you go to see them, okay?
Yeah.
It may well be that both you and the Bristol Wellbeing Therapy Service are right and that you would benefit from a mood stabiliser. What are your views about going on a medication?
I've always been really against it, but I think recently when I've been in a low mood, I've sort of been like, it's not a way to live. Like, if I could help myself to just be stable, then I would prefer that.
Yeah, okay. So I'll get on with that.
Okay, thank you very much.
That's all right. Bye-bye now.
Bye. Hi, have a seat. Hi. Right, what can I do for you?
Basically, I flew home this morning from Spain.
Right.
I come in about 12, and all I can remember was I stood up and I completely blacked out, and my mum said I collapsed on the floor, smashed my head on the patio thing, and I don't remember falling. I just remember waking up 2 minutes after, and she was like, "Am I all right?"
Okay. So that was 12 lunchtime today?
That was kind of when, no, it probably would have been more around 2 o'clock that it actually happened.
Okay, and how have you been? You've been in Spain, yeah? And have you been eating and drinking normally?
I ate on the plane.
Yeah.
And I've drank,
Yeah, fine, okay. And have you drunk much alcohol when you've been away?
I drank about 3 nights in the 12 days, not like every day or nothing like that.
Right, OK. And did you have much last night?
I didn't drink last night.
No, OK. Have you used any drugs or anything? No, OK. Fine. Can we have a little look at you? Is that OK? So I'll just check your temperature. That's OK. Can I pop this on? While that's going up, I'll have a little listen to your heart and your chest, if that's OK.
I feel like my heart's beating really fast as well.
Do you? OK. Just a little feel of your pulse. OK, it is beating a bit fast, actually. And how long's that been for?
Since I dropped.
Right. Just have a little listen to your heart. OK. What I'd like to do is get you to stand up, wait a minute, and then repeat your blood pressure with you standing, if that's OK. All right, so if you stand up. OK, that's OK.
I'll sit back down now.
Yeah. OK. Your heart rate is still quite fast. So what I'd like to do is get an ECG, a heart tracing. So if you go have a seat in the waiting room, I'll ask one of the nurses to do that for me, and then we'll review the ECG and see where we'll go from there.
I'm Dr. Jewel. Hello.
Hi, nice to meet you.
What can I do for you?
During December, I had a really bad acne, so doctors prescribed me with a solution, and I've run out, so basically I needed more.
OK. Did it work? Does it do the trick?
Yeah.
So you're happy with that?
Yeah.
And all you want is for me to re-prescribe it? OK. Somebody's looking after your diabetes, and is it well controlled and you're on top of it and
yeah.
you know what to do? How long have you had that for?
I think since year 9, so around about 2012.
You cope with the restrictions and everything?
Kind of.
You have to live with it. You have to live with it as best you can. So what about the PCOS?
The doctors weren't sure if I was being diagnosed with it or not because they were unclear during my scans. And then they didn't really say much about it after that, so I kind of stopped. So I just assumed that I don't have it.
But unfortunately, they think you have.
Yeah.
Do you understand what it is?
Not really.
No, neither do I.
I kind of have a...
Nobody knows what it is. We know some of the effects of it, but nobody knows quite what the underlying problem is for PCOS. It contributes maybe to you being a bit overweight, which makes the diabetes more troublesome, I guess. And it makes your periods be a bit irregular. Now, we don't mind your periods being irregular and scanty. Do you?
Not really, no.
Good. It's associated with a problem of fertility.
Oh, yeah, I kind of had an idea of that.
So do you have any feelings about that?
Kind of. Well, not now, obviously, but... yeah, I do.
No, but I mean, it might be something that you worry about in the future. There's no way of telling you whether that's one of the effects for you or not. The only way you find out whether you're fertile or not is by trying to conceive. And you're obviously not doing that for the moment. You don't do anything until you either get pregnant. Until you get pregnant, it's great, or until you say, look, I'm struggling to get pregnant. Up till that time, you just let it go. So that was easy. I don't have to do anything to prescribe you some stuff for your face. Is that all right?
Yeah, that was basically it.
OK, how are you feeling now?
Still the same.
Does it still feel the same? Let's just see what your oxygen levels are as well. Your ECG looks OK. It's a little bit fast, but not as fast as it was. And are you normally quite fit and active? Do you do any sports at all?
No, not really, but I do like weights and that.
Right. I think the most likely cause is a faint, to be honest. OK. But I would have thought you should have recovered by now, OK, because we're about 4 or 5 hours later. So I'm a little bit concerned because you've had a flight and you feel unwell with it and your heart is racing, OK. So what I think we need to do is ask the hospital to see you just to check there's no sign of a clot in the lungs. I think it's unlikely, but I don't want to miss it. So if you make your way to Ward 31B, they'll assess you further, OK, and just to be absolutely sure there's no clot there.
Right,
OK.
Thank you.
All right.
Thank you.
OK, no problem. Bye-bye.
Right, Oliver, insect bite. Where's that then?
On the side of my leg.
This looks serious. When did this happen?
It happened a couple of days ago.
Right, where were you?
Ooh. I can't remember.
So when did you notice it? When you were at home later?
Yeah, when we got back from Greece.
Ah, you've been on holiday? Can we put you on that bed there and then I can have a proper look at it? So look, so is it painful?
Yeah, stings.
So what's all this dry patch around here? Is this just crust from where it's been weeping a bit?
Yeah, probably.
OK, let me get some gloves. It's a bit hard, isn't it? So it doesn't look infected at all. It's quite a nasty reaction. I think we just need to put a good dressing on that and just let it heal. Have you been scratching at it?
I was scratching it a little bit and then I stopped because it started stinging.
Yeah. If you scratch it and break the skin, then you get bacteria in from all underneath your fingers into the skin and you can end up with a nasty swelling all the way up your leg, and that's what we call cellulitis, and then you end up having to have antibiotics for that. Just give it a clean. What you want to keep an eye out for is if it starts spreading really far down, or if you start getting lines tracking up his leg or anything like that. If it starts getting really hot or his leg's actually swollen. Sorry. Have a look at it on Friday yourself. And if it looks pretty much the same, just change the dressing. I'll give you a couple. Just change the dressing, and then either way I would come back on Monday and see the nurses just to get it properly checked. So this is bright yellow, so you might see this coming through the dressing, so don't worry too much. If this does start irritating him for any reason, just take it straight off and just pop the plain dry dressing on. There we go. So you need to keep it clean and dry. So don't go jumping in the bath or in the shower with this, all right? So if you need to have a shower or a bath, you're gonna have to do it like that. Do your leg out the bath, all right? Some Calpol if it's sore. If it's hot, swollen, painful, outside of that dressing, bring him straight back. Thank you. You're welcome. I'll see you later.
Bye.
Ho, ho, ho. Merry Christmas. It's a wonderful job that you do.
Thank you.
Is there any chance of me having an emergency appointment because the blasted reindeer stood on my foot and it hurts?
Take you in tonight at 6 o'clock.
6 o'clock. I'll go and do some deliveries and come back. Bye-bye. Bye-bye.
Mr. Robert Tyler, please.
Yep.
I'm Dr. Ahmed. We're just
Hi.
going right to the end.
I think when I came to this clinic, I was assigned to you as my...
That's right. You're
But I did
registered
see
with
someone
me.
else the other day, so...
We tend to follow personal lists. What that means is that tend to see the same person.
Okay.
You can see them, can change if you get fed up with them, so that both sides get to know each other.
Yeah.
It just makes it a bit easier. What's on your mind today?
Strange issue when I do exercise.
Okay.
So if I run, I can jog for about 4 or 5 minutes, and then very quickly, within about 5-10 seconds, I get this feeling of just like I'm going to faint or something. I get dizzy, and it sort of feels like it's here, but not really a breathing thing. I can't work out what it is, and I just stop. I can't force myself to run because obviously your body's trying to say, whoa. So I sort of stop, and if I stop, I just need 30 seconds, and then I can run again for about 3 minutes, and then it comes again. So it's like it builds up. It just.
So you can run for how long?
I did about 2 kilometres. I feel like my head, like I'm almost going to faint. I just feel lightheaded.
But you don't actually pass out?
No, not at all.
And any tightness in your chest or any pain or any pain in your jaw or arms or anything? Leg pains or anything? And this has been going on for how long?
Probably 8 months or something.
About 8 months?
Yeah.
OK.
And I've always had very low pulse.
OK.
So sometimes doctors have gone, and I've just gone for medical or something. I work in the mining industry, so I'm always having medicals. And there's sometimes go, wow, do you feel faint, you know, because I'm on 40-something or...
Right.
And I feel absolutely fine.
You feel fine, that's your standard. OK. I might just check you over, is that OK?
Yep.
So let's just put that on here.
Anti-caravagulist, please. Come on in. Hi, nice to meet you.
And you?
So where do you work at the moment then?
South Mead. I've just come off a night shift.
Oh, bad.
I'm
Poor
still in scrubs.
Poor you.
Yeah.
What are you doing at the moment?
Well, cardiology, but I'm only F1, so
Right.
4-month rotations, so it's not specialised or anything.
And how is it going? Are you enjoying it? Is it?
Sometimes. I think overall I'm enjoying it, but it's the on-calls can be quite bad.
Sure. I did that job many years ago, and it's probably not changed at all in 10 years. But what are we talking about today? What do we need to sort out?
Basically, my urine infections. I've had a lot in the last year, and then it was a little while before I had it again. But then last week, or potentially the week before that, I had another urine infection.
Right. So how many had you had beforehand? Was that something that you'd had?
Yeah, so in the last year and a bit, I've had probably 10, 9, something like that.
Yeah,
Not all
so
of
that's
them.
a lot, isn't it?
Yeah.
Sure. So that was the decision then to start you on the medicine to try and stop them from coming.
It just seemed to work for a bit,
and then have you just had one since you've stopped it again?
Yes.
And that was, which month did you stop it?
Maybe March.
Okay. So you had a sort of 1 to 2 month window where you didn't get any, and then you've had them again just recently. And I mean, from my point of view, it seems very reasonable if you're getting them roughly 1 per month to take a tablet every day to try and stop that happening.
I'm hoping.
So I'm very happy to get that restarted for you. It's complicated because, of course, we don't want to be creating resistance to bugs.
I know.
But on the other hand, if you're taking a lot of antibiotics because you keep getting infections, then you're using quite a lot of antibiotics anyway.
Yeah.
So hopefully, this should mean that we don't need to worry about it in the future. But we'll have to wait and see. So obviously, you can play that one by ear. Good. So those have all gone to the chemist next door. Hope you get some sleep.
Yes. Well, it's the last day, so I'm going to.
Oh yeah, so you're going to try and stay up.
Yeah. I always hate that day.
I know.
Okay, cool.
Nice to see you.
Thank you.
Bye.
Bye.
OK, just breathe normally. I'm just going to listen to the heart. That's fine. Pop your things on. Come and take a seat. All sounds all right in there. So I think something's going on that's changed in the last 8 months or so. So we need to look into it and check it out. So first thing we're going to do is check some blood tests, including checking your cholesterol, your sugar level, your thyroid function. I'd also like to get a baseline ECG or heart recording. It goes without saying at any point if there's shortness of breath or palpitation or chest pain, straight to A&E for a check over. I don't know if your pulse is varying when you're exercising and you're getting some kind of change in rhythm.
Yeah.
We might also have to put a heart monitor on for 24 hours or maybe 7 days, which is a bit of a pain, but, you know...
I had
it's
one
a
once
check.
after the
low pulse?
malaria.
Oh, after the malaria. OK.
Yeah, I seem to have some weird issue.
And the malaria was when?
That was a long time ago, like 15 years, 20 years.
15, 20 years.
And then dengue was about a year ago.
So that
and I was quite ill, so I was medevaced from Sri Lanka to Singapore.
OK.
I was quite ill for a day or two, didn't really know what was going on, and they were quite concerned.
And malaria you contracted where?
I had it twice, Mozambique and Ghana.
Mozambique, I was very ill as well.
Okay.
They thought actually I was going to make it.
Right, okay.
Because I was stuck in a bush camp.
Yeah,
The temperature was at 42.
You've been through a bit, haven't you?
Yeah.
So I'll have a check on those because obviously we don't come across tropical diseases very often to see if there's any long-term sequelae from any of those. But let's do the basics first. We'll check you over and see. So if I give you that, I'll just show
So
you
that's
the
a booking for ECG thing, is it? Oh,
Yes.
Yeah, okay.
If you go to main reception, they'll sort you out, then I'll take it from there.
Okay, excellent. Thank you.
I'll be in touch. Take care.
Okay, see you.
Thanks.
Thanks.
Bye.
Come in, come and have a seat.
Thank you very much. Thank you.
So I'm Dr. Liz Lee. I don't think we've met before,
No, I
have
don't
we?
think we have. No.
Okay.
I had a mental health assessment last week and I had a letter which was about the extra tablet that they suggested.
Yes, Tom Pelly has just written a note, so...
I think it was Miss Dr. Pelly
Have you got it there?
Yes, I have. Yeah, it's the last section.
There we are. So are you happy with this plan? Did you share on that meeting?
Yeah. It's just that I have real difficulty going out and like in social places, town and stuff, just because I feel people are laughing at me, and it's got worse. And I had the assessment, and she said it obviously wasn't a magic cure, but hopefully it would help.
Has this been a long time, this problem?
Yeah, I've had it for a long time. I do all the, no, they can't be laughing at me.
Yes.
You know,
Have you done CBT? Have you done some sort of...
I've done DBT.
Okay.
But not CBT.
What's DBT?
It's dialectical behavioural therapy, and it's to do with your emotions, kind of challenging some of the things that you think. So say I was feeling that people were laughing at me, it would be like, well, you know, they might be laughing at a joke or laughing at something they've just seen, not necessarily me, but when I'm out, it's really hard to get that in. And also it involves mindfulness as well.
That's great, actually. Because I think we all know that feeling of they're talking about me, but actually they're not talking about me at all. I'm nowhere in their thoughts. But what I expect they hope is that this will just calm things down a bit, and the new one that they're going to give, so that then you can use your DBT training more powerfully and begin to sort of actually convince yourself of the truth.
Yeah.
Michelle suffers from social anxiety, and actually this is a really common problem. It's one of the real drivers for the illness agoraphobia, where people just don't want to leave the house at all. We then have to talk about ways of addressing this problem of a false perception, because in fact people aren't talking about Michelle or laughing about her. She just thinks they are. So with DBT, the therapist will work with the patient to try and get them to accept who they are and not constantly be fighting their own personality. And then as a result of that, small changes in behaviour can be encouraged and made, and this makes a great difference to your interaction with the wider world. In fact, you're my second patient today who's got this problem. And what's impressive about both of you is you've managed to come and sit by yourself in the waiting room, which is quite difficult to do, isn't it?
Yeah.
And to come in by yourself. So obviously you're making some progress. Great. So consider adding this other drug called pregabalin. What did you feel about that?
I guess I would be anxious to start it. Yeah.
Right. The talking therapies and medication both work by themselves, but the medication works to settle some of the disabling anxiety, and that allows you to focus more on the quite difficult work that's required if you're going to undertake CBT or DBT. Do you live by yourself?
I do, yeah.
So you haven't got anyone to push you out in the door?
I've got a dog, actually.
Oh, that does work. That's good.
Over the years, I've probably walked a lot more than if I didn't have him.
Yeah. Great, good. Listen, this says for general anxiety disorder, you take 50 milligrams up to 3 times a day. So they also, this warning says that if you're taking anti-epileptic drugs, well, Tegretol you take.
I do, yeah.
Very occasionally, the combination of the two drugs can make you feel really bad in the first week.
Okay.
So I'm just warning you, if you suddenly feel suicidal thoughts coming up. I mean, do you have those sorts of thoughts anyway?
Not so much as I used to, and I feel pretty certain that I wouldn't act on them because I have my dog.
Good.
I wouldn't leave my dog.
No, you mustn't leave your dog.
No.
Great. Nice to meet you.
Lovely. Thank you very much. Nice to meet you.
And you. Very good. Good luck with it all.
Yeah, thank you.
And you just let us know if you get worse. That's
I will.
All right.
Yeah, thank you very much.
Bye.
Bye-bye.
Hello.
Oh no, you gotta go and say hello.
Oh, Mummy, what do you want for Christmas then? Hey, a Jeep. What's a Jeep for Christmas?
Coming in, Santa, my turn? No, I think we'll give it a miss.
I'll brace myself.
You'll have to brace yourself hard.
Bye-bye, see you soon.
Paul Harris? Yes. Yeah, hi. Thanks for waiting. Sorry I'm running a bit late.
OK.
OK. Come and have a seat. Now, what do we need to talk about?
I came in sometime, well, a little while back.
Yep.
Right, my shoulder, my arm.
This was in April when you saw Dr. Ramshaw?
Yes.
Yes.
I had X-ray and some ultrasonic sounds on it. A course of tablets and cream. I would say he's getting a bit worse than better.
Right, and I haven't read all the notes, sorry, because I was running a bit behind. Do you mind if I just have a look through it and see? So, good news on the ultrasound scan. And the shoulder joint, they report as normal as well. So we've done the two relevant tests and neither of them have really given us an answer. Can I just examine you now myself?
Yes, that's not a problem,
So if you just stand up, if I take the weight of this arm now and I try and lift it won't go. No. Okay. Because it's blocked or because it's too painful?
It's too painful.
All right, have a sit back down. So this looks like a condition called frozen shoulder.
Right, OK.
So the two things I think that you've not had are a steroid injection into the shoulder, OK, and physiotherapy. Now, the good news is that frozen shoulder does resolve over time. Do you want me to do a steroid injection now, or do you want to think about it? Or?
I'll do anything just to see what, if it fixes it.
Yes. OK. So it's steroid mixed in with local anaesthetic. OK. Usually it's not particularly uncomfortable. Occasionally it is. I'm sorry if that's the case, but usually it isn't too bad. Don't expect that there'll be a miraculous result. I mean, you may find it's more comfortable for several hours because of the local anaesthetic, and then that will wear off, and then you'll be back to normal. There's always a theoretical risk of infection getting into the joint, which is bad news if that happens. The risk of that is about 1 in 2,000, I believe. I've never seen it happen, so I don't think there's any particular reason why it should happen to you. OK? Now, actually, you'll need to take your shirt off, so if you do that. Great. Stand up. So there's a prick coming up now, all right? I'm putting in more local anaesthetic than I would normally use in this situation. I'm just trying to distend things within the joint a little bit. Is that OK?
Yeah.
Not uncomfortable?
That's OK.
All right, yeah. OK, do you want to pop your shirt back on? Just give that arm a little bit of a move around, actually. So if you try and do some of those movements we did before. Yeah, OK. And we'll try and get some physio for you as soon as possible, OK? Any problems after injection, let us know.
Right, thank you very much.
OK, all right.
Thank you.
Cheers.
Thank you.
This is Jim. Jim is our car park attendant.
Car park manager, I like to know. So basically, we have lots of problems with parents trying to park their cars in here during drop-off and pick-up times. I don't know whether you're one of them. No. So I let you in there.
Jane Byram. Hello.
Hello.
Come on in. Hello. So I'm Dr. Lee.
Yes.
And I'm doing a funny thing today. I'm working with our new doctor.
Oh, right.
And I'm seeing the patients and she's putting it on the computer. Is that all right?
Yeah, that's fine.
OK. Come on in. Come and have a seat. So if I could put you there. So this is Dr. Leslie Black, who's just joined us. Right, so what can we do for you?
I keep feeling really sick all the time. I have no energy whatsoever, and it's just driving me mad at the sickness feeling. I have been sick a few times, and if I'm not sick, it tends to just give me a really bad stomachache, and it just feels like everything's stuck and won't digest, and it just wants to come straight back up again. And it's been going on for about 3 weeks now. And we went out for some food last week. I only had a ciabatta and I felt so ill afterwards. So I've just been sticking to sort of squash, water, tea and fruit and salads. I just want a nice roast dinner and not feel sick.
3 weeks is a bit long, isn't it? It's gone on too long now.
Yeah.
So I'm going to get you to lie over here. Let's examine your tummy.
All right,
Have you had blood tests done or anything?
No, not recently.
Okay.
Well, not recently, no.
I'm just going to listen to it for a minute.
OK. Makes me feel really sick when it just... Sorry.
Well, it's very overactive. There's a lot of noise in there.
OK.
Let me just take your pulse and things. It's a very nice, steady pulse.
I just feel really...
Yes, I can see you do. You can see it in your face, actually.
I just don't seem to have any stamina. Obviously, I know when you don't eat enough, you know, you can feel a little bit weak and stuff, but...
So we need to do some tests.
OK.
Start with some blood tests. If we do those now, we'll get them back tomorrow, most of them, and then decide when we see what your blood shows, what other tests you should have.
OK.
Leslie, can I ask you to do this? I'm sorry not to show you.
That's fine. Right, let me wash my hands.
So I'm going to do full blood count.
OK.
I'll do a celiac screen while I'm about it. But I want to do a bone profile. Anything else you would suggest?
TFTs?
Oh, yeah, because you're tired as well. I will do a
I'm feeling a bit hot.
Yes, of course. We'll do those things.
OK. I love taking blood, but I don't like blood counting.
I know. Do you know I'm the same?
Very good. I'll ring you tomorrow.
OK.
Is that all right?
Yeah, that's absolutely fine.
OK. Is that all right? That's a bit worrying, don't you think?
It's not quite right, is it?
Not quite right, and she felt very sick when I pressed here. I couldn't feel her mass.
Whereabouts was it?
Just over descending, but not at the bottom, so if she's got anemia, 2-week wait in tomorrow for the endoscopy. We'll do a colonoscopy.
OK.
If she's anemic, we do both, actually.
Yeah, OK.
Because I'm worried about her.
Yeah, definitely.
Morning, Bridget. Come on in. How are you?
Knee was 3 times its normal size.
Oh, no.
Through part of last week and right up until Sunday. It's going down a bit now.
Oh, my gosh.
It's so painful. I presume it's arthritis. If you look now, you can see that it's not normal.
No.
And the pain is around there, through the back. I've been rubbing some of the deep heat in to try and see if that helps, but not really.
Have you had it like that before?
Not like that, no.
No. Strange, isn't it? Let me just see who the duty doctor is a minute.
My husband eats a packet of biscuits.
I could
with
quite.
every cup of tea he has.
Oh, I could do that. Depends what it is. Give me some custard creams, jammy dodgers, and also ginger biscuits. Love them. I do like my custard creams, I've got to say. I love my custard creams.
Oh, hello. Oh, here he is. Come on in. This is Hello. Hello. This is Bridget Callahan, who I see every week for a leg ulcer.
OK, so your knee swelled up and was
It was
painful.
literally sort of out here. Couldn't walk properly. And that's when it sort of basically started, Monday night, Tuesday morning, and it was literally round here. And the pain was pulling from here and across underneath there.
Okay. The swelling has come down somewhat, but the pain hasn't got any better?
Not really, no.
Okay. Have you had problems with the knee before?
Only since the accident.
Okay.
I had an RTA.
Do you mind if we, while we're talking about it, we get you up on the bed? Okay, so you've got naproxen and cocodamol on your prescription on a regular basis?
Yes.
I'm going to press in a few different places.
Okay. Yeah. Sorry.
So what I want to be sure is that it's a problem with the knee joint and not a problem with the other structures around it, like the blood vessels or the muscles. I'm fairly confident from examining it that it's a problem with the knee joint.
Right.
We don't want to miss blood clots or those kind of things, or skin infections, and I don't think there's any evidence to suggest one of those things. The knee cap almost seems to be floating, so it's quite bouncy, which suggests there's some fluid underneath it, in and around the joint, which would suggest perhaps a flare-up of arthritis, and it's common to get arthritis in joints where you've had broken bones around it. I guess we need to try and get you a bit more comfortable.
Yeah.
A simple change is go from 3 to 4 times a day for the cocodamol, squeeze in an extra dose, taking it 4 times a day. Having your leg elevated, resting up, making sure your leg is at least as high as your hips, ice it. So anything from the freezer, wrapped in a tea towel so you don't get an ice burn. 15 minutes on there may be quite soothing and bring down some of the inflammation. These things tend to flare up and then settle down. If it's not settling down over the course of the next week or so, we need to have another look at it. Yeah, absolutely. Okay, I'll leave this here and I'll leave you guys to it.
Thank you.
Nice
Thank you very
to
much.
meet
Very much.
Okay.
Thank you.
And I'll just scribble on notes on there.
Thank you very much. You want to stay there?
All right, I don't
Might as
mind.
well, aren't you? Now you're there.
Yes, it's leaking off.
I can see it's leaking, yeah. Which you don't often leak, do you? So something's going on.
Yeah, because I had a bath this morning to make sure it was clean.
Yeah. Looking pink around the edges, isn't it? I was wondering if I ought to do a swab while you're here.
Is it normal for the sort of purple to keep coming up as it is, or is that just...
The what?
Sort of the coloration.
The coloration. This is circulation, isn't it? Yeah. Let me just take a swab on that as well.
No, it's getting in the stage at night, it gets so hot.
Yeah. We're going to be high enough, is it, Bridget?
I think it probably would, yeah.
Let me help you down, all right?
Yeah.
Oops. Hop along. Let's hope it all settles down now.
Well, hopefully, yeah.
Hopefully, yeah. Open the door for you.
Yeah.
Take it steady then.
We'll try.
Try. You haven't got much choice with that knee, have you?
No. All right, then.
All right, take care
Thanks,
then. Bye-bye.
And Whitehead, please.
That's me.
That's you. Hello there.
Yeah.
Come on. Brought reinforcements?
I have, yes. She brought me down.
Do you want to take that seat there? Yeah. So, you family or friend or sister? Sister. Okay. All right. So we've got some blood results to discuss, haven't we? Can I just go through the background first of all?
Yeah.
You asked Pete in the pharmacy to do your blood test, or he
He offered to do the... He offered, because I was a bit concerned.
Getting very thirsty, was that?
Dry mouth. Very dry mouth. But it's just carried on.
And how long has that been going on for?
It's quite a few weeks now.
And by drinking a lot, give me an idea how much you've been drinking.
Glass after glass.
Glass after glass after glass?
Glass after glass,
OK.
yes.
And mainly water, or?
No, fizzy, juice.
OK.
And that.
Something with sugar in or not?
Probably, yes.
So weight, first of all, has that changed
yes,
in any
it
way?
has, because...
In what way has it changed?
I've been off of work for over a year now because of the had bleed on the brain, and my mobility is was severely.
So you put weight on, have you?
And I have put weight on.
Okay. Do you think she's changed at all? Lost weight, gained weight?
I would say gain.
Gains weight. Okay.
Around especially. It's the middle, especially around the middle.
Have you had any thrush recently? So
No.
dry, sore mouth, or white down below?
My mouth seems to feel like it's on fire sometimes, but other than that, no.
Okay. So you wondered if you had diabetes, obviously, from what we
Or
said
just
on the phone.
checking my sugar level, really. That was all.
Pete did a blood test which was
Yes,
high,
well,
the sugar
yes.
level, and we've done blood tests now, and they point the same way, really. So so yes, I think I have to say you do have diabetes, actually.
Right. Okay. Yeah.
So that's not a complete surprise to you.
It runs in the family.
You say it's in the family. What do you know about it?
All I know it's raised sugar levels and it needs to be controlled. My father had to inject.
Okay.
My uncle's got it. My grandmother had it as well. Okay. And I know the consequences is your feet, losing feeling in your feet.
Okay.
And your nerve endings.
Yes, that can
something like that.
Yeah.
And your eyesight, is it cataracts? Glaucoma, that's...
Well, it can cause various things to do with the eye. Glaucoma wouldn't be the commonest, but when you've got type 2 diabetes, which is what I'm sure you've got, there's a problem with the way that the body handles the sugars that have come from your diet. Okay?
I'm feeling a bit more tired.
Yeah, so you can feel tired, you can feel very thirsty, all sorts of things. Yeah. So next thing is we need to look at your diet, okay? And I will get the treatment room nurses to have a look at your diet with you. And we almost certainly are going to need to get you onto some form of medication to lower the blood sugar. So I'll print off some information sheets. I'm going to book an appointment with the nurses. They will give you a long appointment to go through all this with you, and then we'll take it from there. Okay.
Right.
Okay.
Yep.
All right. Well done.
You cycle a heck of a lot, you know.
Well, compared with most, yes.
I would just pop it over there if I were you. At least then we can try and keep an eye on it for you.
When you say 200 things...
Kilometres.
Kilometres over what period of time?
That'd be 14 hours. So if I pass out, you'll have some kind of record.
Racing for an hour. And two of the guys threw up on the finish line. And I gave myself, I pretty much had heat stroke.
James Francie, please. Come on in.
Thank you.
Hi, have a seat. How are you doing?
Yeah, I had ringing in my ears, so I know what's caused it. It was a band practice a few months ago.
Was it? And your hearing hasn't been affected since then?
I haven't really noticed it being affected.
So it's just this ringing. And is it on both sides?
Yeah, I don't know, that's a good question, actually. I haven't really tested to see if it's
But it's not obviously just on one side, for instance. It seems to be on both sides.
It seems to be.
And you haven't noticed any dizziness or falling over or any other symptom? It's just this annoying ringing?
Yeah.
Can I have a little look in?
Yeah, go for it.
Have you had any thoughts about what's going on or looked it up online?
I looked it online, thought it was tinnitus or something like that.
Yeah.
And, it doesn't really look positive for getting rid of it.
No pain at all? Do you put anything in your ears, like cotton buds or...?
Yeah, cotton buds.
Yeah?
Yeah.
OK. What I can see is that both the eardrums are mildly indrawn, and they should be nice and flat.
Yeah.
And sometimes, if the pressure's not right on the inside, it can suck the eardrum in.
Okay.
And what we want to try and do is get your eardrum nice and flat.
Okay.
Now, whether this is going to change the tinnitus is not clear.
Okay.
Because sometimes tinnitus, unfortunately, is just a condition, as you've looked online, where you get this annoying ringing. So in the first instance, let's try some nose drops of steroid.
Yeah, OK.
And the reason they're good is because they help open up the tube that goes from the back of your throat and nose into the ears, the eustachian tube.
OK.
And you know about when you go on an aeroplane and you pop your ears?
Yeah.
I want you to do that loads.
OK.
Second, these cotton buds can push in the eardrum, and that can be part of it, so try and avoid those. There's no wax at all, and olive oil probably is a good way of clearing any wax if you've got that, but there's nothing from the outside to see other than the mild indrawing. It's certainly not bad, but I think this would be a good strategy to try and help everything that we can do.
OK, yeah, sounds good.
The other thing is that with no hearing loss and no dizziness, and it's just on both sides, it probably is just sound-related, tinnitus.
Yeah.
So hopefully we can make some progress with the spray.
Okay.
But if it's not settling down, then the other thing is just to read up about distraction techniques.
Okay.
I don't know if you've read about white noise or putting some earphones on, because sometimes you can just train your brain out of hearing those annoying ringing noises.
Okay.
Cheers then. Hope that does the trick.
I hope so.
Cheers.
My favourites.
Hello, Mr. Scudder.
How the devil are you?
How the devil are you?
Well, now I've seen you two, I'm bloody
Good.
fine.
And now we've seen you, we're fine too.
So how many toes we lost this time?
2. So I got 3 left.
We've still got 3 left.
Come on, darling.
Oh, doing it the wrong way. Yeah. All right.
Right, we have landed. I'm being absconded now.
See you later, my sweetheart.
I know you worry about me.
I do worry, Michael. Hang on, pull your trouser leg down yet.
Anything for you, my love. He's bloody magic.
Michael Scudder. I've been trying to talk to you for a few days, but whenever you're in having your dressing, I get called to something else and so on. But I know you're here early in the morning.
I am, my love.
Come and take a seat.
Thank you, love.
I'm a little bit worried about what's going on with you, a little bit, because over the weekend you had this hypoglycemia, or your sugars went a bit low.
Yeah, it went right down, yeah. And lucky I collapsed on a settee, like, you know what I mean? But it's my fault, because I wasn't eating.
But why weren't you eating?
I don't know. I just, it was all the worry. I keep going up there and all this nonsense, getting on my nerves.
Yeah. Are you vomiting up food?
No.
Because you said to one of my colleagues...
I was just sick. I was just my stomach upset. That was all, just getting now and again.
So when you eat your food, it's going down okay?
Yeah.
Okay.
I've lost some weight, man.
Yeah, you have. Are your bowels working normally?
Yes.
No blood when you go?
No blood at all.
Mm.
And I always I'll check this because it's for a reason, like, when I go to college in July, they say, I said, well, where am I bleeding? I can't understand it. I got this camera down there and it's all clear, like,
You've had the bowel check last year, and we don't need to repeat it. But last year you also had the camera test, which showed,
twice.
A stricture. So what happened was that there was a tightening in your food pipe, and then when they repeated it, that had cleared up.
Yeah, that's right.
I'm wondering if that's reoccurred again. How do you feel about if we just repeated the camera test?
I don't really want it.
To double check?
Because I keep going out there all the time and it's doing my head in, like,
I know.
I got this morning.
Because of the foot, haven't you? I know.
It's just doing my head in. Keep going up there all the time and it's getting right on top of me.
Because what I would like to do is I'm wondering why your blood count has dropped. You see, I don't know if you're losing blood from somewhere. That's the only reason. One thing that would be good is if we could do a wee sample. And
I'll bring it in tomorrow.
That's fine.
Okay.
And we'll probably do a blood test, but not today.
All right, my love.
We'll do it towards the end of the week just to see what's happening.
Okay.
I've also referred you back to the blood specialist, but I don't know if you've had an appointment through.
No, I haven't, no.
Okay.
Well, let's say, I was wondering if I had cancer come back again, but they would have found that by now, wouldn't they, surely?
So what's been going on?
So Eden has had a bit of a rash for a while, about 8 weeks in total.
Oh, right.
It didn't seem to be bothering her at first, but now it seems to be getting a bit itchy.
Okay.
She's been starting to itch the one on her legs, and then it's been getting a bit more, like,
so it has got a bit worse there, has it? Yeah.
So started off with a patch on this arm,
Yeah.
which has actually improved slightly with the sun, I guess,
Good.
as you'd expect.
Hello.
And that patch was there for a couple of weeks, and then sort of there was a bit more on this arm.
Yeah.
And then it came onto one of her legs.
So she's fine at eating and drinking normally?
Yeah,
and
I mean, she's
Hello.
teething at the moment, so she's had a bit of problem with that, and she had a bit of a snotty nose last week, but generally she's very
been
well
okay.
in herself.
Can I just take your temperature? Yeah, you're fine, aren't you? Apart from this annoying rash. Well, it's a little tricky to say what's causing it. I expect that this is just a little bit of infantile eczema, and that means dry skin linked to being a baby.
Yeah.
So 2 things I'm going to try, some good moisturiser and just a tiny, tiny dose of steroid to see if that settles it down. Does that sound okay?
Yeah, that sounds perfect.
It's very mild and we shouldn't be needing to use that for very long, sort of up to 5 days maybe. So if there's any ongoing problems, do pop back to see her.
Lovely, thank you.
Good, hopefully that'll do the trick.
Brilliant, thanks very much. Get you
Great.
sorted.
Nice to see you.
Say bye-bye.
You're out with the door.
Oh, thank you.
Cheers, Em.
Thanks, bye.
Bye.
What if I wanted to organise a scan whereby you lie in one of those tube things and they do a scan, an X-ray of this bit off you?
Out there?
Yeah. How would you feel about that?
I suppose.
You'd be okay with that, would you? It's not as invasive as having a,
No.
you know, because I think I need something to
All right.
to work out what's going on.
Do that then, my love. There's a party next Tuesday down in Western Supermare. I've been invited down, so I'm going to go down there for a day out. I'm alive. I've just got to get away, like, you know what I mean? I'm gonna
Have a break.
Yeah, I'm going to have a drink.
Not too much.
No, but, well, I'm going to have a drink. And I'm going to take some sandwiches with me. I'm going to spoil myself for that.
All right. Well, I think you do deserve your own treat, but if you're happy for me to scan you...
Yeah, I will do.
I'll do that.
All right, my love.
All right.
Yeah.
Thanks for coming in. I'll come out with you because I've got to call the next person in.
All right, then scan.
Okay.
Yeah. Got to take all my clothes off for that. You know that, don't you?
You just get one of those sexy nighties to wear, though, don't you?
I know. All right, my darling. Yeah,
Okay.
arrange that then, love. And I'm,
All right. We'll see you soon. I'll speak to you soon.
Open wide. Say ah.
Keep saying ah.
Oh, I'm sorry. I'm so sorry.
Keep saying it. Well done.
Say ah.
Can we have one more go?
And again.
Oh.
Okay.
What's been happening?
So, on Sunday night, I started feeling really unwell, and then started feeling really shivery, and then tonsils, massive.
Okay.
Temperature was like 38.8, 38.9.
Oh, right.
Every time I've had tonsillitis before, I've taken penicillin V.
Okay.
And I had some of that at home, so I did start it, even though I know I really wasn't meant to. But I couldn't come off work, so I had to start it.
Okay, so how many days worth have you had?
I literally just started, like, yesterday.
Right, okay. So no loud singing, shouting?
Not particularly. I am quite a loud person.
This must be killing you then.
I know, yeah.
Have you had any painkillers in the last few hours?
No, actually I haven't, so hopefully, like, the pain is definitely not as bad as it was.
Okay.
I work in a hospital, so one of the doctors checked me over on Monday, and he said it looked like viral. He didn't think it was bacterial, but he said there'd be no harm in taking some antibiotics anyway.
Which doctor said that to you?
I know.
Bad doctor?
Bad doctor.
Okay. Deep breath in. They are definitely swollen. They're certainly not full of pus or anything like that. Particularly sore?
They were, but they're much better
Not
today.
too bad, yeah. Okay.
They were massive.
Are your ears okay? Any earache?
Ears are sore, all up my neck is sore.
Have a stand up for me a second.
It's driving me slightly mad.
Any pain here at all?
Not particularly, no.
So your ears are really red.
Okay.
So again, that would fit more with a viral sort of. A little bit red, but your eardrums are nice and clear and shiny. If you started the penicillin, then we probably need to finish that, really, because if it was bacterial, which I'm not convinced that it is, it could just come back and be bigger and stronger, nastier. OK, I need to get this signed by the duty doctor, so if you have a seat in the waiting room, and I'll bring that out to you when it's signed. All right?
Thank you so much.
You're all right. Nice to meet you.
You too.